Uh, hearty welcome to Honorable Governor, Srimati Dr. Tamilisai Soundararajan Garu, today's Chief Guest of the program, and also the Rajeshwari Garu, Member of Insurance Regulatory and Development Authority, Shri Anil Agarwal Sir, President of FTCCI, Shri Meela Jaidev, Senior Vice President of FTCCI, Shri Suresh Kumar Singhal, Vice President of FTCCI, Shri Shekhar Agarwal, Chair Healthcare Committee FTCCI, and also Shri Bejon K. Mishra, Chair Health Insurance Vision 2030, Telangana. Invite you all onto the stage and please take your seat. I request everyone to please stand for national anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड़ उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तब शुभ आशीष मांगे गाहे तब जय गाथा जन गण मंगल दायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
I request our Honorable Governor, Srimati Tamilisai Soundararajan Garu, and our guest of honor, Srimati Rajeshwari Garu, and all the dignitaries on the dais to please light the lamp and inaugurate the Health Insurance Summit 2030.
शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्परब्रह्म दीपज्योतिर्जनार्दनः दीपज्योतिर्परब्रह्म दीपज्योतिर्जनार्दनः दीपो हरतु मे पापं सत्यादीपनमोऽस्तुते ओ दीपब्रह्मरूपस्त्वं ज्योतिषां प्रभुरव्ययः ओ दीपब्रह्मरूपस्त्वं ज्योतिषां प्रभुरव्ययः आरोग्यं देहि पुत्राश्च पतिं गच्छामि मे
Thank you. And now I request our President, Shri Anil Agarwal, to give a brief welcome address. Thank you.
Srimati Dr. Tamilisai Soundararajan ji, Honorable Governor of Telangana and Lieutenant Governor of Puducherry, Srimati S.N. Rajeshwari ji, esteemed guest of honor, member Idai, and all other distinguished guests on and off the dais. I welcome you all to this Health Insurance Vision 2030 Summit. It is an absolute pleasure to have the Honorable Governor with us today, who is not only a distinguished leader, but also an outstanding medical doctor. Madam, we are grateful to you for accepting our invitation to inaugurate today's Health Insurance Summit in spite of our busy schedule. I am truly honored and privileged to extend my warmest welcome to you on behalf of FTCCI and myself. Madam, this is a 106-year-old organization and has contributed significantly for the growth of industry, trade and commerce. We do more than 100 programs in a year, madam, for the development of industry. And recently we have inaugurated our skill center also to upskill and reskill and improve the employability of the youth. Though we are an industry body, after seeing the unprecedented impact of pandemic, which has resulted in sufferings and numerous deaths among the citizens, we have felt that there is a need for a health committee, and we have constituted the committee on July 1, 2020. Though it is only 3 years old, we have done many programs addressing the healthcare issues and contributed significantly to the strengthening of health services. We have contributed in health sector since inception, since last 3 years, in many areas. Notably is real-time services to citizens and members during pandemic. These services included free online medical consultations, arranging hospital beds, quarantine facilities in hotels, supply of oxygen cylinders, plasma, and conducting vaccination camps, etc. We would like to acknowledge and appreciate the continued efforts of Government of India, the Government of Telangana, many institutes, doctors and professionals in improving the healthcare services. But still there is a very huge gap in the demand and supply. The gap can only be addressed when the Sarkar, Sanstha and Samaj, that is the government, the institute and society, come and work together. Madam, I am pleased that many dedicated teams of doctors and institutes are working towards achieving this goal. On behalf of all members and citizens, I humbly request the Honorable Governor, who is an eminent doctor and a highly acclaimed public leader having a deep concern for the citizens, to kindly guide us on the patient-centric health insurance and patient-centric healthcare for all 4 crore citizens of Telangana. So without taking much time, I express my deep gratitude to Honorable Governor for gracing the program and inaugurating this summit and encouraging us all. Thank you.
Thank you, sir. And now I invite our guest of honor, Srimati S.N.
Madam will speak.
Due to paucity of time, we will request our Chief Governor, Honorable Governor, Srimati Tamilisai Soundararajan Garu, to please address the gathering.
A special good morning to each and everyone here. First of all, I congratulate you for taking a very important cause. The Summit on Health Insurance Vision 2030, organized by the Federation of Telangana Chambers of Commerce and Industry. Sri Anil Agarwalji, the President of the Federation, Sri Jayadev, Senior Vice President, Sri Suresh, Vice President, Sri Shekhar Agarwal, Chair Healthcare Committee, Professor Bijan Mishra, Chair Health Insurance Vision 2030, Srimati Rajeshwari, Guest of Honor, members of the Managing Committee, past presidents, eminent speakers, esteemed media friends and other participants. So many programs I have attended. Just before this program, I attended a program which was conducted by the super abled children who needs special care and with a disability. They are practiced in javelin throw, shot puts, cycling. So when we see that, it is very disheartening to see, because people without any problem, we are all, whether we are putting our efforts to that extent as the children put their efforts to exemplify in their commitment. Why I am starting with that? Because medical need. I am standing in front of you as governor, but my specialty was fetal therapy. Fetal therapy, when I see children with disability, I went to study fetal therapy in the very great institution of hospital for sick children at Canada, only to prevent the disabled births, anomalous births. Because fetal therapy, we do cordosynthesis, cord blood sampling, chorionic villus sampling, amniotic fluid sampling, so that to find out any chromosomal abnormalities are there, and if there are abnormalities, we can counsel the parents, and if at all we are unable to counsel the parents, and if the disabilities are very intensified, then we have to abort the child. Otherwise, we have to prepare the parents. If it is identified in a later part of the pregnancy, we have to prepare the parents to get a child like that and then motivate them. So many things are there. So these all need monetary assistance. Why some people can go for fetal therapy? Why some people cannot go for fetal therapy? And why even in this era we are getting children like that? So we have to introspect that whether the medical facilities have reached everyone. Unless the medical facilities reach each and everyone, like right to have food, right to have good clothing, right to have education, right to have medical help is also the basic right of each and every citizen. So only I laud our Honorable Prime Minister when he brought the Ayushman Bharat. More than 50% of the population can have tertiary care. As a doctor, I have seen so many patients losing their life for want of few thousands. And particularly the awareness about medical insurance, even now it's questioned. Even well-educated people, if we talk about medical insurance, they say, no, nothing will happen to me. I am a healthy person. Even when we talk about awareness, nobody think unless they fell ill, unless they fall ill, unless they have a headache, or unless they have some problem, nobody believes they will be healthy ever. So this type of mindset, talking about ill health itself, unauspicious some of the people think. So it is the need of the hour. Such summits on health insurance, Vision 2030, and particularly I am really happy that he told in the introduction, Mr. Anil Agarwal, they are conducting 100 meetings in a year for business. I appreciate you. And as a doctor, I appreciate the health meeting also had taken place in that 100, and really I am very happy. Because unless we have health, unless we have a good sound body and mind, whatever may be the business, I always say, we are calculating our currencies, but are we calculating our calories? So it is as important as calculating the currencies. No, we will take it and we will save it, but as doctors we say, we have to calculate the calories also. We have to, if you have taken more calories, then bank people or the business people won't tell to spend. But we say, you have accumulated more, spend it, spend it, spend it, so that you have to be hale and healthy. So don't save more fat, save money, no problem at all. So these all things to be, the awareness should be there. And apart from awareness, the basic thing about master health checkup. The concept, I always say, when you celebrate your birthday, the next day of your birthday or the previous day of your birthday, please go for a master health checkup. Because it is very rare now, people crossing 40 without diabetes or hypertension. Somehow these two sit on our head and make all complications in our body. Eyes, brain, kidneys. So this master health checkup, and the economy is very important. When I was practicing, one person, he had some problem and I prescribed some of the tests, and after getting all the results, he came to me and told, doctor, don't tell that nothing is there in my body. No problem, no disease. I told everyone, it's a vice versa. Everyone will tell, please doctor, I should not have anything. I should not have any disease. I should be healthy. But you are telling, please doctors, don't say nothing, no problem in your results. Please tell some problem. Then I told why. My wife will scold me, for nothing you spend 3,000 rupees for all the tests. So if it should be justified. So it is not the mistake of that person. That is the financial situation of each and every family. So they won't, because if they spend, so something should be there, otherwise their family will accuse. And apart from that, the health of women, I always very much concerned about that. They will put a budget, and the first budget cut when the expense exceeds is the health back of a woman. She will go to the kitchen and she will take some asafoetida or some cumin, and she will satisfy her symptoms and she will finish it off. So particularly when breast cancer, cervical cancer situations are like that, so health insurance should be on preventive sector also. And also it should be for high technology procedures. Nowadays robotics, laser treatment, and all these type of non-invasive treatment has come. So only these costly treatments are affordable even by an affluent person only through medical insurance. And through you, I appeal the medical insurance companies also. They should be simple. And I have seen, even in one of my relative, he spent, and then the insurance company refused to give the money. And they told, in your symptoms, you didn't tell anything about chest condition, and you got admitted for a chest condition, so we won't give the insurance. So you didn't predict anything. It cannot be predicted, particularly during COVID and all. Even the person who didn't have any ailment in any of the organs newly developed it. So this is a collective effort by the business people, by the medical fraternity, or even the insurance companies, and apart from that by the patients. Patients should think insurance is, yes, form of saving, not only saving, it is saving our life. Nobody thinks like that. They think it's an extra expense. Please be aware of the medical insurance. And because when I was practicing, one patient was very sad. I told, don't be very sad. Don't be sad. What will happen? He told, I am not sad. What will happen? How much will happen? Only my worry. So that is the problem each and everyone has. As doctors, we also can help the patient, but when some gadgets are needed, some disposables are needed, for higher investigations are needed, so it is not in the doctor's hands. So it is in the hands of the person who is doing the expenses. So we have to think all these things and must be very careful. And first primary thing in our life is health. How many of you do yoga? I don't know. Please raise your hands. Okay, put your hands down. But do yoga, do meditation. One of the person asked, you are asking me to do yoga, you are asking me to do meditation. and you are asking to have some naturotherapy, and will prevent, will treat heart attack. I told, when you do all these, less incidence of heart attacks. So you please make your habits, try your habits, so that you are every day spend some time for your body. I met one very important person. He says 2 hours morning, 2 hours evening, 24 hours for others, 20 hours, but 4 hours only for me. I do walking because this is needed now, particularly in conditions like tension conditions. Now we are tensed for everything. Tensed what? I asked one patient, what is the tension? No, what to wear, what blouse to wear, what serial to see, and after seeing the serial, more tension escalated. So all these things we had, these are challenges. Then the social media healthy. That is the request of another, not only governor, as a doctor and as a social person. Thank you so much.
Madam, request you to please accept a small memento as a guest of honor. Thank you, Honorable Governor Garu, for gracing the occasion and despite your busy schedule. And now I invite our guest of honor, Srimati Rajeshwari Garu, Member, Insurance Regulatory and Development Authority, to please address the gathering. Sorry, Madam, for making the protocol here and there due to the paucity of time. Thank you.
Good morning, everybody. First, I will thank the Honorable Governor of the state for having addressed us excellently well. She started telling that yes, it is the right of every citizen and required and need of the hour. And I can very well say that the regulator is also working in line with that only. So the vision of the regulator is insurance for all by 2047. So when India is completing 100 years of independence, we want to see that fully the society is insured. It is that every citizen has a life cover, health cover, a minimum personal accident cover, as well as a property insurance, and also all MSMEs are covered. So this is the goal with which we are working. And Indian economy is one of the fastest growing economy, and the insurance industry is directly linked to the growth of the economy. So the industry after pandemic has started recording a double-digit growth. And since today's topic is health, I can say happily that the health insurance sector is growing at 24% growth in this FY23, registering a premium of 82,000 crore. And it is growing year after year. The IRDA is focusing to multiple the growth. This is not sufficient. So we have to grow further. So the regulator is striving to increase the growth. And as you know, before pandemic, the awareness of insurance was not that much. After pandemic, the health insurance awareness has increased, and COVID claims are still there. So the non-life and the standalone health insurance companies have settled around 26 lakhs of hospitalization claims, quantifying it to be around 25,000 crore is the amount. And life companies have settled around 2.5 lakhs of claims till this March 23 for a quantum of around 18,000 crores. So this is the number of COVID claims which have been settled and being settled. So the settlement rate, I will say the repudiation and the outstanding is less than 10%, and more than 90% of the claims reported have been settled on a fast track basis also. And the regulator has already started simplifying the processes to make ease of doing the business, and also leveraging technology wherever is required, and expanding the distribution network. And the customer service is the central focus in all the activities of the insurance company. There is a Bima Bharosa portal, which is an online grievance registration and redressal mechanism, where the insurance companies, the customers can board on that and register their complaints. The regulator also on live basis coordinate to redress the grievances. Also there is a ombudsman mechanism. If anybody is not satisfied with the insurance company's decision, there is an ombudsman mechanism available, 17 ombudsman offices across the country, where the customer grievances, the retail customer grievances are addressed on a fast track. Within 30 days they are being addressed. Everything is free of cost for the public. As Madam said, prevention is better than cure. So it is very much required to take care of the primary health care is required. And also this is recognized by the authority. We are encouraging the insurance companies to offer discount, to offer reward points to those who maintain preventive health care, who undertake wellness activities also. That because like she said, after a diagnosis you come across, and the secondary and tertiary care will be costly, but this primary health care will be cheap and also can save life. Out of 140 crore population in India, I can say 21 crore are covered under insurance other than government scheme.
Create something, it has to be done in consultation with all stakeholders, and all stakeholders are here. Thank you very much.
Thank you, sir. Before inviting our senior vice, and also the plant, Mohammed plant also. No. Madam, because of the very short time that is given by Governor Garu, the whole program has gone here and there. So there is a small release of brochure of the Vision 2030. So we request you and also the other dignitaries on the dais to release the brochure, ma'am. Brochures.
Has become a standard. So it has obviated the need for a plastic card. Everybody stores the policy number in their mobile, right? In terms of an email. Third, importantly, the payments have really become very smooth. So 2016 UPI was launched and just before COVID, and because of that, a lot of improvements have been made in the payments.
And of course, now insurance companies are readily available, making it available, annual health checkup, disease management, something earlier people used to keep the policy in the drawer, not to use any time. Today that is changing. People have started, last year we had about 15 to 18% people going for checkups. So people are increasingly using policy other than the hospital claim also. So this is what my submission is for in the 4 buckets of service delivery. There is improvement. Now, since this whole summit has a topic of Vision 2030, right? I think what is future? I think future, in my view, has to be blue sky, something we did not imagine, but is possible, right? And for that, I must give a reference of airline industry, because this is an industry very close to health insurance in terms of delivery, because it's a real-time delivery. There are in airline there are pilots and the moment of truth, how the care is delivered, how safety is taken care. It is also important in health insurance and hospitals together, right? So we all remember in 2005 there were 3 ticket copies. One was a customer copy, one was an airline copy, one was an agent copy, right? And if you lose the ticket, it was like you lose the money. From that we have e-tickets, then we have boarding cards. Okay, now today like in Delhi airport and certain airport, DG Yatra, that if there is a boarding card, at least not for heart attack or emergency, but for about 70% of planned hospitalization, before.
My suggestion is, can we set up a committee between insurance, healthcare providers, NHPH, can do that one thing. I think this council should have achieved this. It's all understandable. The where we stand now today is something different because they related to several aspects of it. It's not related to one of it. But anyway, because of the time factor, because I had several things in my mind. Initially, it was given a 1 hour. I think we are just wrapping up within no time. Please, sir.
నెట్ కేబుల్ ఎట్లా ఉంది నెట్ కేబుల్ ఎలా ఉంది
Mr. Adil will subscribe to my opinion. At a throwaway price, they gave insurance.
ఇక్కడే
Later,
ఇక్కడే
that the market share, they sold it off for a good amount of money. Of course, it's business. They were doing business. Now, people who were insured with Apollo Munich in the streets here, they could not pay the highest premium.
మీ దాని నుంచి మీ దాంట్లోనే ఉన్నారు
And people who have stayed back with the Canara Bank key, now they have burnt their finger. Especially senior citizens, where they are paying 50,000, they are paying 80,000, 1 lakh.
మీ దాంట్లోనే ఉన్నారు
Now, the kind of
నెంబర్ రాసుకోమన్నారు సో
playing in the system was the
94
best.
వచ్చింది ఇంకేం ప్రాబ్లం లేదు
In
సార్
fact,
వచ్చేస్తారు
When people like him, who keep
Awesome.
ऐसा लगता है
See, I understandable. See, and that, say, I am practically, that is, no, I am the practical person for that. See, I am paying a lakh for my, that, no, what I mean to say, it is not the blame of, it is not one person's this thing. It is, see, every sector is involved in this. We cannot blame one.
కెమెరాది ఇది
because there was a Apollo Munich entered, you can get fraction figures like
No, they this even after paying 20th, they started paying with 40,000, end up with paying 1 lakh also. So that is what is happening. That these things should not happen. So for all these things around that this, what is?
only one point.
No, please, last one. Yeah.
What is the problem with the startup?
Okay.
Right from the 1 year age to the 100 years age.
ఏదో అప్పుడే చూసుకుంటారు
Like PAN card, Aadhaar card.
ఏదో అప్పుడే చూసుకుంటే అయిపోతుంది
Aadhaar card for a patient, all India basis,
It can help a lot for anybody. So that is nobody is talking, sir. If you take care and preventive measures can be so actual valuation today. So that is sorry, sir, which I was looking that will help a lot to the patient. Can I say sorry for the next question? Master data. Other chance for me. So sorry, so
Most of them from TPS and insurance companies. I hail from Nursing Home
after community, I
Association.
know.
Nursing Home Association. Our problem is tariff. Kindly increase the tariff. GIPSA, since 2015, most of the hospitals are not renewed. Why? This is 23.
Yeah, these
This is
are
not right. Why GIPSA is cheating? Why GIPSA is cheating? All insurance companies, national companies are cheating.
right, Ashok.
No, they are cheating. Just you take. Because
Okay, point is
mind.
taken, Ashok. Okay.
This has to be taken into consideration.
Right.
Many hospitals are collapsed, sunk, and they closed. They shut down their doors.
Okay,
in the
right.
500 hospitals closed in the Hyderabad city. They are cheating. They are looting.
Right,
GIPSA
Ashok.
is looting all hospitals. At the cost of the hospital services, 32,000 I was paid for 9 years.
Right, okay.
No, not only it looks that all of you are from TPS and insurance companies. I am from the hospital. What the health vision 2030 without buying? I am a service provider. Looting my property. You are giving at the cost of your benefit and you are taking money from the customer and looting the hospital and paying to them.
Right.
That is TPS you are giving service.
Okay.
I am a service provider. No, please. You listen my voice. I am telling you. This is the meeting of the hospital. Many hospitals are being looted by the insurance companies. I am telling you.
మీరు ఎంతసేపు లేదు సార్
Okay, thank you very much. I think we had very interesting and usage sort of a because it can sorry sir for everybody. Hari Ashok.
I was state vice president last year.
So that's the reason. Chalanti, correct. I know because there discussion can go on from either side. No, I'm sorry. No, I'm very sorry about it. I'm very sorry. I'm not taking any more questions. Ashok, please sit down there. Please sit down. No more. Okay. Yeah, Mr. Mishra, Vijay. Yeah.
వీడియో బ్లాంక్
Listen, friends.
If you have questions, you want to say something,
హలో
we are
నేను
awake
రమేష్
till
అండి
12
సుబ్బు
midnight.
ఇచ్చారు నంబర్
Okay, we are awake till 12 midnight. Stay on,
ఇది ఎన్ని డేస్ తీసుకుంటాను
listen to
చెప్పారు
the sessions. At the end of the session,
హలో
when we finish on time, we give opportunity to everybody to speak. But do not speak out of turn. Please,
ఒక్క నిమిషం
you are all gentlemen, you are all disciplined people. Do not try to raise your voice. Be very polite, disciplined. If you are not, you got security. Don't do it. Yes. Thank you very much. Right. If you are really keen to speak, stay on. We are with you till 12 midnight.
Right. Okay, I think absolutely fine. I think we have gone to a lot of discussions went on this. I thank our panelists and all the audience for a sort of a real wonderful practical session we had. Thank you. Last but not the least, I want to make a small comment. See, everybody in the hall, I am sure, they have four-wheeler. Everybody is interested in taking the insurance the moment before it gets, some due date is there. Next month, immediately they will take. As far as the health insurance is concerned, nobody takes it. I think this is one thing also has to be kept in mind. I keep always telling everybody has to take health insurance and they give more importance to their car rather than their own health. Thank you very much. And thank you everyone. Have a nice day.
May I call upon on stage Dr. Vimod Kandamohan, Director of National State and Staff College.
239
Very request you to come on stage.
780. Seven. వీమిక్స్ చూస్తారా మీరు వీమిక్స్ చూస్తారా లేకపోతే ఓబిఎస్ఆ రెండు నేను ఓబిఎస్ వచ్చింది ఇప్పుడైతే ఓబిఎస్ నడుస్తుంది వీమిక్స్ చూడండి ఒకసారి దానికి వీడియోలో అయితే లేదు ప్రజెంట్ సరే ఆ నెంబర్ తీసుకోవా ఇది డిక్లైన్ చేస్తా హలో ఎనీ డేస్కు ఇంకో నెంబర్ చెప్తాను అది తీసుకోండి 875 086 970 ఒక్క నిమిషం ఇస్తాను
We have few important guests in the coming up session, and they are going to be very energetic and enthusiastic session. Kindly request you all to have lunch and come by 2:00.
970 అది కదిలితే పోతుంది మళ్ళీ స్టాప్ చేసి స్టాప్ చేయాలి అట్లనా
ఎక్స్క్యూజ్ మీ
చేశారు
సార్ కొంచెం ఇది లైవ్ యూనిట్ ఉంది ఇక్కడ కదిలితే పోతుంది
అది ఇన్పుట్ లేదు
ఇంకోటి పెట్టాలా
ఇస్తున్నా ఒక్క నిమిషం ఏంటి బయట హోటల్లో ఇచ్చాను అదే ఎఫ్ఐ 100 హెచ్డి ఎస్డిఐ కాదు కాదు
ఆల్ 50లో పెట్టండి
ఓకే డన్.
ఆల్ 50.
50i మనం 25 పెట్టాము, 50p పెట్టాము. భయ్యా कैसा देना
बैक से
जरा जाओ नहीं
సార్ వాళ్ళు ఏమన్నా బ్యానర్ అంటే పెట్టేసి వదిలేమంటున్నారు.
దీంట్లోనే ఉంది సార్,
బ్యానర్ ఉందా?
పెండేలో ఉంది, మీకు ఇచ్చాను కదా.
దాని తర్వాత ఏం చేయాలి మళ్ళా?
అంటే అర్థం కదా సార్.
ఇప్పుడు బ్యానర్ పడుతుంది, దాని తర్వాత మళ్ళీ కెమెరా కావాలంటే అక్కడ స్విచ్ చేయాలి, అంతేనా? నేను
అది లైవ్లో ఉన్నప్పుడు తీసుకోలేదేమో. నేను 2-3 చాలాసార్లు ట్రై చేసాను, అన్నీ ట్రై చేసాను. ఇక్కడ పోయింది అది.
తర్వాత ఇది క్లిక్ చేస్తే కెమెరా వెళ్తుంది, అంతేనా? రెండు అలా ఆన్లో ఉంచేసాము.
స్ట్రీమ్ ఇవ్వాలి సార్.
తర్వాత స్ట్రీమ్ ఇవ్వాలా?
స్ట్రీమింగ్ అవ్వట్లేదు మంచిగా. స్ట్రీమింగ్ ఎర్రర్ వస్తుంది మనకు
ఎట్లా?
మధ్య మధ్యలో ఇందాక పోయింది, అదే ప్రాబ్లం.
అడగండి. ఇప్పుడు స్ట్రీమ్ వెళ్తుందా లేదా?
ఇది ఒకసారి స్ట్రీమింగ్ ఆటోమేటిక్గా ఆఫ్ అవుతుంది, ఎర్రర్ వచ్చేసి.
ఆపొద్దు, అట్లా కంటిన్యూ చేసిరా. నేను ఉంటా.
ఎయిట్ 7-5 086 970 లాస్ట్. చూడండి మా ఇంటికి మొత్తం సరిపోతుంది కదా, లేదా చాలా బాగుంది, బాగుంది. కొట్టు కొట్టు. అదే బ్యానర్ పెట్టి ఎక్స్టర్నల్ కాదు, స్ట్రీమింగ్. అవ్వట్లేదు, కొంచెంసేపు వస్తుంది, మా అంటే 5 నిమిషాలు వస్తుంది. మళ్ళీ అదే సారీ ఎర్రర్ చూపిస్తుంది. అది నెట్ ప్రాబ్లం. వేరే వాడు వాళ్ళు తీసుకున్నారు యూట్యూబ్ దే. మేడం వెళ్తారా? నహీ మ్యామ్.
లేదు మేడం, పక్కనే ఉన్నట్టు అక్కడ ఉన్నాడు. లేదంటే అక్కడ ఆ బోర్డు బ్యాక్ సైడ్.
జస్ట్ సరే సరే. ఇది కొట్టద్దు స్ట్రీమ్, అది నెట్ సిస్టమ్
స్క్రీన్ కొట్టి అదే ఉంచేసాను
సార్. అది రావట్లేదు,
ఇది
పోతుంది. అది నెట్ ప్రాబ్లం ఉంది అంటున్నాను ఆయన కూడా.
నెట్ ప్రాబ్లమా?
ఇది పోతుంది, ఇది కాదుగా
ఎల్లు వస్తూ ఉంటుంది అది అంతే.
అయినా పర్లేదా?
పర్లేదు, అది దానివల్ల ఏమవుతుంది?
మనకు రాదు మళ్ళీ.
వస్తుంది చేస్తున్నాడు కదా ఆయన, సెట్టింగ్స్ చేస్తున్నాడా?
నెట్ బ్యాండ్విడ్త్ సరిపోవట్లేదు అంటున్నాడు. అయిపోయింది, కట్ చేస్తాడు ఆయన. అయిపోయింది, ఆయనతో మాట్లాడేది
అవుతుందా?
ఆయనతో మాట్లాడేది అయిపోయింది సార్ అంటున్నాడు.
ఓకే, సెట్ చేశాడా?
వీడియో ఓకే, ఇది మాత్రం నెట్ ప్రాబ్లం ఉంది అని చెప్తున్నాడు.
అవట్లేదు,
నెట్ బ్యాండ్విడ్త్ సరిపోవట్లేదు. ఇప్పుడైతే ప్రెసెంట్ ఇది ఇచ్చాను, ఆల్రెడీ ఇంతకుముందు ఉన్నది ఎస్ఏఎంఎల్లో పెట్టాడు, చూడండి, లేదంటే ఓబిఎస్ పెట్టుకోండి అంటున్నాడు.
ఓబిఎస్ అని ఇచ్చైతే అవుతుందా?
ఓబిఎస్ అయితే ఓకే.
దీన్ని తీసుకోండి మరి. ఇది బెటర్ కదండి, ఇంతకు బాగా
అదే ఇదే బాగా వచ్చింది కదా.
ఇది బ్లాంక్ వస్తుంది, బ్యానర్ రావాలంటున్నాడు కదా ఆయన.
పెట్టేస్తాను, దీంట్లోనే పెట్టేస్తాను.
Only we need to promote that. We need to only promote that. How do we do it?
ఇప్పుడు అదంటే మనం అది కేబుల్ పెట్టినా కూడా రావట్లేదా? వైఫై బెటర్.
చూసాడు, ఇదో చూసాడు, బ్యాండ్విడ్త్ సరిపోవట్లేదండి. అవును, బ్లాంక్ వస్తుంది.
ఎంత వెళ్ళిపోతుంది ఆడియో? సరే ఉంచండి అదే దాని కాదు.
వస్తుంది, ఒక్కసారి మారుస్తుంది.
బుల్ట్ అది ఆపేయాలి.
ఒక్కసారి దానికి కాల్ చేస్తాను సార్.
అక్కడ ఇక్కడి నుంచి మాట్లాడుతాను, ఆడియో వస్తుందని చూడండి. ఇన్బుల్ట్ ఆడియో తీసాను. ఎనీ డెస్క్ చెప్పండి.
హలో, ఇంకో చిన్న హెల్ప్ చేయవా నాకు? ఇది ఓబిఎస్ ఆన్ చేసాము, దాంట్లో ఆడియో వెళ్తుంది సెట్టింగ్స్లో. ఆడియో ఇవ్వనా ఇది? ఉంది. అది కాదు, ఇది వేరే అలా మ్యాచ్ సిస్టమ్. ఇది 540239 780. ఆడియో వచ్చేస్తుంది, మైక్ ఆడియో తీసుకుంది ఇది. తెలియదు.
Sri Anil Agarwalji, the President of the Federation, Sri Jayadev, Senior Vice President, Sri Suresh, Vice President, Sri Shekhar Agarwal, Chair Healthcare Committee, Professor Bijan Mishra, Chair Health Insurance Vision 2030, Srimati Rajeshwari, Guest of Honor, members of the Managing Committee, past presidents, eminent speakers, esteemed media friends and other participants. So many programs I have attended. Just before this program, I attended a program which was conducted by the super abled children who need special care and with a disability. They are practiced in javelin throw, shot puts, cycling. So when we see that, it is very disheartening to see, because people without any problem, we are all, whether we are putting our efforts to that extent as the children put their efforts to exemplify in their commitment. Why I am starting with that? Because medical need. I am standing in front of you as governor, but my specialty was fetal therapy. Fetal therapy, when I see children with disability, I went to study fetal therapy in the very great institution of hospital for sick children at Canada, only to prevent the disabled births, anomalous births. Because fetal therapy, we do cardiocentesis, cord blood sampling, chorionic villus sampling, amniotic fluid sampling, so that to find out any chromosomal abnormalities are there, and if there are abnormalities, we can counsel the parents, and if at all we are unable to counsel the parents, and if the disabilities are very intensified, then we have to abort the child. Otherwise, we have to prepare the parents. If it is identified in a later part of the pregnancy, we have to prepare the parents to get a child like that and then motivate them. So many things are there. So these all need monetary assistance. Why some people can go for fetal therapy? Why some people cannot go for fetal therapy? And why even in this era we are getting children like that? So we have to introspect that whether the medical facilities have reached everyone. Unless the medical facilities reach each and everyone, like right to have food, right to have good clothing, right to have education, right to have medical help is also the basic right of each and every citizen. So only I laud our Honorable Prime Minister when he brought the Ayushman Bharat. More than 50% of the population can have tertiary care. As a doctor, I have seen so many patients losing their life for want of few thousands. And particularly the awareness about medical insurance, even now it's questioned. Even well-educated people, if we talk about medical insurance, they say, no, nothing will happen to me. I am a healthy person. Even when we talk about awareness, nobody think unless they fell ill, unless they fall ill, unless they have a headache, or unless they have some problem, nobody believes they will be healthy ever. So this type of mindset, talking about ill health itself, unauspicious, some of the people think. So it is the need of the hour. Such summits on health insurance, Vision 2030, and particularly I am really happy that he told in the introduction, Mr. Anil Agarwal, they are conducting 100 meetings in a year for business. I appreciate you. And as a doctor, I appreciate the health meeting also had taken place in that 100, and really I am very happy. Because unless we are calculating the currencies, no, we will take it and we will save it, but as doctors we say We have to calculate the calories also. We have to, if you have taken more calories, then bank people or the business people won't tell to spend. But we say, you have accumulated more, spend it, spend it, spend it, so that you have to be hale and healthy. So don't save more fat, save money, no problem at all. So these all things to be, the awareness should be there. And apart from awareness, the basic thing about master health checkup. The concept, I always say, when you celebrate your birthday, the next day of your birthday or the previous day of your birthday, please go for a master health checkup. Because it is very rare now people crossing 40 without diabetes or hypertension. Somehow these two sit on our head. And the economy is very important. When I was practicing, one person, he had some problem and I prescribed some of the tests. And after getting all the results, he came to me and told, doctor, don't tell that nothing is there in my body. No problem, no disease. I told everyone, it's a vice versa. Everyone will tell, please doctor, I should not have anything. I should not have any disease. I should be healthy. But you are telling, please doctors, don't say nothing, no problem in your results. Please tell some problem. Then I told, so if it should be justified. So it is not the mistake of that person. So something should be there, otherwise their family will accuse. And apart from that, the health of women, I always very much concerned about that. They will put a budget, and the first budget cut when the expense exceeds is the health backup of a woman. She will go to the kitchen and she will take some asafoetida or some cumin and she will satisfy her symptoms and she will finish it off. So particularly when breast cancer, cervical cancer situations are like that, so health insurance should be on preventive sector treatment, and all these type of non-invasive treatment has come. So only these costly treatments are affordable even by an affluent person only through medical insurance.
For the insurance sector, are we starting a new landscape for the insurance sector?
You said, ma'am, that we aspire that every citizen of the country will have insurance. Very correct. Of quality, basic tenets of patient safety, which are hand hygiene, they should be followed. Fire safety should be there. So beyond, some basic things are there, and that entry level, Dr. Alex also spoke, Dr. Bijon Mishra sir is on our board also, and he very rightly brings forward the agenda of patient advocacy. You know, who's taking care of the patient? All of us are patients. Even if I'm a doctor, some of the time I'll have to be. Right? So somebody I should know is taking care, and these standards which are by the government heavily subsidized, heavily subsidized, and they are very easy to follow, extremely easy to follow, should be form the basis. I will take a pause here, but
Over to you, Ramakrishna sir. We'd like to have your thoughts on this.
Good afternoon, everyone. I represent the Argastri Healthcare Trust here on behalf of our CEO, ma'am. The changes that have been made in the last few years is that the white ration cards were there which were issued in the year of 2010, and after that these white ration cards are not there. So recently what we have done is the food security card, which is the valid one, and that is the live one, and the particular person whosoever is correcting the food security card usage, and then these are the people that are eligible for getting the services of Argastri services. That way we have got 90 lakh families that are covered under Argastri Healthcare Trust. The number of packages that were there were 1025 previously. From that now we have got 1669 packages, and some of the high-end packages which were not there previously, like say the knee replacement and other things, are also being planned to be included under Argastri after some time, though it's not for public perusal, but that's one thing. The other important aspect that we see some as we think about the way forward for 2030 is that the accountability of the hospitals is also taken care of, in the sense that there is a regular audit of the treatment that has been provided to the beneficiaries, especially in those cases who have had an unacceptable or not very favorable outcome out of the procedures. All those cases are subjected for an audit, and then death audit reports, whatever have been done by the hospitals, those are reviewed once again. And in situations where there is a need, we give a feedback to the hospitals to bring about changes in the quality of services that are there, either in the operation theatres or pre-anesthetic workup or evaluation of a beneficiary before being taken for surgery. Such are the suggestions that we are giving to the hospitals. So far as the beneficiaries are SMS saying that there is a pre-authorization raised on your name, on your card. This is in order to see that there is no misuse by X person using the card of a Y person or things like that. So these are some of the things that we have brought about recently, and it's our intention to see that the clearance of the bills can be hastened up where there we have a problem. But I think that's one thing which is our priority, which is governed by various other wheel within wheel. So these are the issues that we are taking care of. Another thing is the awareness that is required to be given to the persons whosoever are being given treatment for these high turnout procedures, like say wherever there is a cardiac problem, counseling the family and other things with reference to various preventive aspects that could be there, so that such problem doesn't recur in the genetically related persons. These are the things that we are doing. And the other change is that prior to 2019, the package amount per family was 2 lakhs. That has been now raised to 5 lakhs per family per year. So these are the changes that have taken place in Argastri Healthcare.
Wonderful, sir. I would now request...
Presenting on behalf of our Additional Director, Dr. Prabhakar Rao. So, first thing I expect in any meeting where there are hospital representatives, the first question I always get is when are the rates are going to be revised. So, I am fortunate, before I sit here, our people have already revised the room rent and consultation, and very soon you are expecting the revision in package rates. It's in the final touches. So, has been there since, but obviously it was designed for packages, but we also completely cover the consultation. We have in-house primary consultations, doctors. Then we have specialist consultation through our empaneled hospitals. We cover the entire medicine expenditure, entire investigation expenditure. So we do provide such medicines too. So this is one system which we have perfected in the last 50 years. Obviously it is funded by government, so it's not influenced by the market forces. But this is a system where multiple models like the US model, which some. Thank you.
Good afternoon all. I am from ESIC. I am Additional Commissioner for Regional Office Telangana. First of all, I would like to say that ESIC, this I say because the rate by the employers and 0.75% is borne by the employees. So for such 4% contribution payment, the available benefits under ESI scheme are totally like comprehensive. I can say, I can use the word comprehensive with total confidence because it includes sickness. If a worker is sick, then for the period of sickness where he cannot go to his job, so he need not be paid by the employer. Employer is also saved on that cost. And on the other hand, this compensation, wage loss compensation will be made good by the ESIC. And the treatment for the sickness will be provided by the ESIC, be it primary care, wherein only OPD services are required, or whether if it is secondary care, where hospitalization is required, or even if it is super specialty care, where tertiary care hospital treatment is required. All of this, the IPs will get free of cost. Free of cost in the sense for the payment of 4% contribution. There is no upper ceiling for the cost for any of the treatments. So there is no person will get for 7 days. A schedule of 34 diseases which require long duration treatment. And during this long duration treatment, the worker may not be in a position to go to the job. So he will get paid leave from the corporation. And it will be from 124 days to get back healthy back to the office. So this is not only good for the IP himself, but his family and for his company and the whole ecology and the system and society. And there is this, when there is an injury results in incapacitance. And this incapacitance, what happens is they may not be in a position to go to office. So we also give temporary disablement benefit. So this is for the entire period of temporary disablement. He will be getting wages up to level of 90% for the entire period. So this is there, and once the this temporary period is over, that is the treatment is over, he is sent to a medical board wherein they will assess the extent of incapacity. So this extent of incapacity is assessed as a percentage of loss of wages, loss of earning capacity. The whole of life of a person, he will get this compensation because of the injury, because of the incapacitance, he has lost his capability to earn at the earlier level, so it is compensated. This is also there, and then maternity benefit. Maternity benefit, a woman gets if she has contributed for only 70 days in 2 contribution periods. Contribution period is a 6-month period, which starts from April to September and then from October to March. So in any one contribution period or 2 contribution period, if payment is made for 70 days, only 70 days, which is around 9-10 weeks, so the woman will be eligible for receiving 26 weeks compensation at 100% of her wages. So 26 weeks she will get, and she will get it for 2 children, 2 live children. And even in case where there are miscarriages, they will get it for 6 weeks time, and that is also twice. And then we have this dependence benefit. Unfortunately, if a worker dies in the course of employment injury, his family, the spouse, will be paid the pension for throughout her life or till remarriage. And this covers even all the dependents. The dependents will be parents and the children, and in respect of children, both the male and female are included. Female children till their marriage, And in respect of male children, they are covered up to the attainment of 25 years. Initially it was 18 years because of the representations that at 18 years of age, children will still be studying. It was extended up to 21. Now it has been extended up to 25 years. Then unemployment is part of the life of a average wage worker. So in the course of any unemployment, which happens because of the thing which even we covet but we don't get is ward of IP certificate. That is, the children of these workers will get some seats for MBBS courses in the institutions run by the corporation. There are 8 institutions currently being run by corporation, and in these 8 institutions, the wards of the workers, they will get an opportunity to get a seat. We have seen so many number of these children get into these institutions, pass out, and then they are now serving the corporation. Then there is also a vocational rehabilitation scheme, wherein due to disability, a person can no more continue in his existing profession. So he is trained in a different vocation. And this entire charge 123 rupees per day, whichever is higher. If the charges is higher, then that charges is borne.
Having heard you, Mr. Renuka Prasad ji, I think the in-depth detail which you have shared with us is really, really good. And having heard the success stories from all stakeholders in the panel, I think the flip side, that is our major concern is this reaching and is the awareness being consumed by the end consumer well? How much are we able to reach out there? Having said that, I would like to address to the panel, and starting with you, Mr. Prasad, what are some of the innovative initiatives and reforms which you would like to share that you are creating to build awareness? I mean, all of this what you've said, somewhere, some things we all know, but how is the awareness being created in the larger segment of the society? End user access to information and privilege to getting immediate solutions is what we are addressing now.
Well, with regard to immediate redressal of, in case of any solutions, we have a public grievance mechanism wherein it is closely monitored both at the headquarters level and also our level, and any grievances are settled. Insofar as the awareness of the scheme goes, the awareness is there because the awareness is also there, and our corporation is also conducting frequent awareness camps in various outer districts of the state of Telangana. And last year I think we conducted 4 to 5 awareness camps, one in Cherlapalli Industrial Area Employers Association. And generally we approach the Employers Association because through the associations we will be in a position to attract large audiences, and because one employer means there will be hundreds of employees. So making aware one employer will spread the awareness. So that is why we are conducting these awareness camps. And I feel all efforts are being made, but still I think we can still improve, and we can still improve.
Yes, definitely. I resonate with the fact that yes, we have a lot of scope of awareness building which is needing to be worked on largely. Over to you, sir. Mr. Funny.
First thing we are doing is we are sending bulk SMSs to all our beneficiaries whenever we have a new initiative. And we are holding every month health webinars. So wherein anybody from anywhere in India can join. I think around 10,000 people capacity it is, and we are going to increase it. Then we are holding panchayat meetings every 2 months, where we are calling all the stakeholders. We have the pensioner associations, serving associations, we have the ALCs, the authorized local chemist who supplies the LP medicines. We have representatives from the hospitals, and we address their grievances. As a part of government department, we also address the PMO grievances. We have CP grams. Apart that, we also have a separate grievance system wherein every beneficiary can log in our website using his mobile number and lodge his grievance, and these grievances are being cleared every day and every week. Okay, and then we have advisory committee meetings and zonal advisory committee meetings. Advisory committee meetings are conducted at wellness center level, and zonal advisory committee meetings we are going to start from this month, wherein we will have two pensioner representatives and one area welfare officer who will be from the serving side, and these people will be part of the committee which reviews the way our organization is functioning. So it's not just about the listening to their grievances and solving them, but they will also be part of the functioning of the organization, how we are improving our services, how we are implementing our policies.
I think that's really commendable work that's happening. I'm sure that when we do our Q&A session after the speaking of Mr. Ramakrishna, I'm sure we will share the open house and we'll get more feedback on that. Over to you, sir.
Yeah, thank you, ma'am. So essentially, traditionally the client of NABH has been the hospitals. So they are very well aware about us. But as far as the creating demand from the consumer, the actual patient is concerned, this is one area where I'll admit we have been not focused from the consumer directly, and we'll be soon launching a very massive media campaign, focused campaign, so that we can go to the next orbit, and the actual on-ground demand can be generated by when the patients start visiting a hospital and start demanding quality. See, the theme of the workshop is quality and affordable healthcare. So affordable healthcare, insurance industry will definitely take care. They are penetrating, they are creating products which are very friendly and very pocket friendly, and ultimately, as you said, we aspire to private enterprise. It will reach. But what about quality? So quality is the thing which NABH can address, and a significant push will come when the patients start demanding quality. And they say currently they are just thankful that they have received. So no longer I think that will work. Going forward, I think public funded facilities are as answerable to the consumer or the common citizen as a private player is. So we'll need to work on that, and we welcome your suggestions, guidance, and John sir is also guiding us. So I think going forward there's lots of scope here, and we realize now that only way we can push that demand and go to the next orbit of accreditation, certification is by creating a consumer demand.
Earlier in the day, I think one of the panelists had addressed that all stakeholders are working in their closed box approach and not at the end of, and now everybody's target is the consumer should be satisfied. Consumer satisfaction is top line for everybody. But the point is they don't come into the same perspective, and those perspectives is what at FTCCI we are trying to initiate and bring about a resonance and coming together to make an effective reformation platform. And I'm sure with stakeholders like all of them on the panel, things will change and we will be the change makers.
Yeah, thank you. I think this is the moment to congratulate once again FTCCI, because this is a fantastic initiative bringing all of us together and under one roof and deliberating and discussing. So compliments to the leadership.
Thank you so much, sir.
At Arogyasri, one thing that has been there from inception till today is that all discharged patients are addressed a letter signed by the Chief Minister to give a reply about any grievance that they have. It's a self-addressed, trust-addressed letter which is there in it, and all the replies that come are audited. And recently, 2019, there is another activity that we have done. Once the patient gets discharged, a IVRS message goes to a particular person saying that are you satisfied with your service? If you are satisfied, press 1. If you are not satisfied, press 2. If there is any money collection, press 1. If there is no money collection, press 2. So sort of an activity has been started, and then where we have found that about the reply rate was around 85% of the people only, but then the satisfaction rate was in the range of about 87%. So the other 30% whatever was not there there was a misunderstanding in punching the keys, that is around another 6%. So this is one thing, but truly what is the level of satisfaction of the beneficiary, that's one issue which we need to address. I think from the inputs from FTCCI we will take it up further. Thanks for the input.
Thank you so much for recognizing the efforts at FTCCI. As an industry body, always we are addressing the fact that we bring industry reformations for the progressive perspective, and that's the very intent of FTCCI. Having said that, I'm opening the house for questions. I already have a question written and sent to me by Mr. Praveen from Bangalore. Can I have, yeah, yes, Mr. Praveen, would you like to address the question yourself, please?
This is a question to Dr. Atul Mohan. There are regulatory bodies for insurance like IRDA, for banks, RBI. So I would like to know if is there a plan for a regulatory body for hospitals?
No, there are so many regulatory bodies already actually. Why do you want another one? So regulation, regulation is mandatory. Regulation, there are already, if we were to think very like literally, there are, I think there are 183 clearances which you require to run a hospital, starting from registration to BMW to fire safety. So all these are registrations. While NABH like standards are voluntary, they are little aspirational. They are patient safety. Yeah. So this is a voluntary, but government incentivizes this. Whichever organization completes the standard, gets the certificate, is incentivized to the tune of 5%, 10%, 15% based on their level of certification. So there's a push by the government towards quality. So we are speaking about quality because quality cannot be made mandatory. There are countries like Australia, and maybe India's time will come. Australia has made it mandatory. There are many other countries which have made it mandatory. But worldwide, majority of the countries have kept it voluntary.
I would like to know if the government of India has a data of hospitals, like the number of hospitals registered, because registration happens at municipal level also. Whether that has reached the government of India.
I think that has been the bane of India because health, fortunately or unfortunately, has been the state subject in the constitutional list. So each state is working differently. So that kind of has created that we need a central sponsored scheme, and Ayushman Bharat is one such right step in the direction. NHA, we work very closely with NHA also. And we are delivering so many policies and other things. All standards are currently incorporating all 4 tenets of ABDM also. And NHA also under the PMJ recognizes our certificate as a coterminous basis.
I'd like to add on that ABDM point that sir has just mentioned. So under ABDM, the central government is working on creating a repository of all the health professionals and all hospitals. So, and every citizen of this country is going to get, and we have one account which has all the health details and entire health history. The work has already started. I think very soon it will be completed. And very soon we are going to have one health account where the entire health data of every citizen will be stored and can be accessed anywhere across India.
So in the Indian context of very soon, what is the approximation of that? On a lighter note, I'm sure you all will want to know.
They have given us a target of 1 month, and the 1 month we have already missed by 5 months due to technical reasons.
So 2024 for sure. 2024 sure.
So there are many software issues and technical issues.
Just let me add to that. That's a very important point. There are 4 tenets of ABDM. One is Aadhaar number, Ayushman Bharat health account. That is Aadhaar number. One is health facility registry, health professional registry, and the 4th important thing is interoperability. But this is a very complex environment. Government has already implemented it in 32,000 hospitals. Under the public funded scheme, but private hospitals may or may not, they are being incentivized. So this may take a lot more time, But there's a parallel thing where ABDM or at NABH we have already integrated all the 4 tenets in our standards. We are also doing the validation for all the EMR software which are currently available in Indian market. There are 600 plus software. So NABH has already started the scheme for validation of such EMR, HIMS and LIMS software which we are doing.
I will have to take a few more questions, so I think gentleman here.
Good afternoon. My name is Dr. Chaturvedi. I do cancer care, Swastava cancer care. We do cancer awareness and screening in rural areas. I have 2 questions to ask. One is to our friend in Arogyashri. Why there is no provision for investigations before admission? Any private hospital, cancer patient, if you have to admit, they will ask for diagnosis. For diagnosis, there is no provision in Arogyashri. Why is that? Actually, it is like this, sir. The workup that has been done, once the confirmation of diagnosis is made, that is factored into the package that is there for the treatment for the case. It is not true that there is no package exclusively. True that there is no exclusive package for investigation, but once the workup is done, that amount is taken into consideration for the treatment part. That's what is the concept. For the last 5 years, I am working on this. 1 minute. I made so many representations. I am very happy you said it is increased from 2 lakhs to 5 lakhs. Yes. It is excellent. Yes. Please see that diagnosis also is included so that people do not suffer. 1 moment. I have one question for... 1 moment. Another small component. Yes, sir. Right now, for all the... in some time it is going to come for the diagnostic workup. Already because Ayushman Bharat Prime Minister Jan Arogya Yojana is having investigative packages which are likely to be included under Telangana. It does not have. Even Ayushman Bharat does not have. It has got not even for past year. I know about it. Okay, so this is one. Now, I'm kindly go through that. I'll also be in touch with you. I'm taking your number now. I'll come and meet you in the office. I have one question for our friend from CGHS. Why CGHS patients are not admitted in private hospitals? I'm telling you, I worked in private hospitals. CGHS patients are not admitted.
Sir, we have a grievance system. This is something that keeps happening because we have low rates. No hospital would like to admit 100% of their beds CGHS patients. So there will always be a situation where the hospital would say we don't have beds. So whenever you have an issue, you have a mobile number of a nodal officer. We have a doctor who is handling it, and he will be able to guide the beneficiary to the right hospital.
Yeah. Can I, madam?
Yes, of course, sir.
Yeah. I am Dr. Singh. I am very happy, first of all, to be an Indian. Second, to staying in Telangana as well. And luckily, we are privileged to have so many schemes, so many benefits, so many programs and all those things for the people. And we have people sitting on the dais who have got very good ideas about it. But here, I'm not pointing out at anybody. Please don't take it seriously or don't take it on. Sensitization and awareness is very, very poor. People don't know what are the things they have to go through that. And in case of my 2-3 employees also, they have not got the money still back. She died during COVID and all. That's one part of it. Now the second is during admission also we had a lot of difficulties in admitting the patient in the ESI because I had to go at 2 o'clock in the morning to admit the patient in ESI. Spent 2 hours there sitting in the rooms. That was one. So not complaining about anybody, but system can be improved. Now about the other thing like CGHS. CGHS, we have about 40-45 beds. I tried a lot. I went to Delhi also. I went to minister. There was a local minister. I went to his house. Then he asked money for that. I said, I can't afford the money. We are ready to serve. Third is,
Sir, how long is your question?
No, just enough. Just one point only. So everybody we want to help out the people as he asked. Chakravarti Garu has said, private, we want to do that as well. Now the third thing is, about the NABH, it's a very good program, but different SSLs to Arogyashri, we tried, then again, same again bribe there. So we refused and
So
came
you are
back. Thank you.
addressing
Just
the
to
same
bring awareness and
perspective.
correct the systems. Thank
You're
you.
addressing the same perspective which we are also kind of opening discussions for. Yes, sir, please go ahead with your question.
Madam, I want to ask question.
Your good name, sir?
My name is AVS Dikshit. I am representing CADCO, Confederation of All Telangana Consumer Organizations. So first question is to Ramakrishna Garu. Sir, recently from March 1st onwards, there is a linkage of ration cards to Ayushman Bhava cards. Do you know that?
See, the food security card, what I mentioned,
yes,
on the basis of that only the...
they are doing linkage. But suddenly, March 30th, they stopped the linkages. What is the reason?
Linkage between Ayushman Bharat cards and this thing you are telling, sir?
Yes, cards. This food security cards.
Food security cards
from 30th onwards, from 30th March onwards.
I think you can take this offline because this is not relevant to the panel session.
Madam, another more question is there, madam. Regarding this, because Ayushman card is, there is a registry problem is there that I want to ask us. 2nd of March, one patient admitted in Durgabai Deshmukh Hospital, sir, regarding heart problem. They have done surgery. And second time also she got again heart problem. At that time they informed the hospital people informed that they have to pay the amount 35,000. Is it correct or not?
No, it is not correct. There is no need to pay any thing. If they have a receipt of that, it will be reimbursed. No problem. They can give
one more question to sir. Is there any scheme for self-employment people? For in ESI.
No, for self-employed as on date, they are not covered. Under Social Security Code 2020, they will be covered. Yeah, Social Security Code on Social Security 2020, under that self-employed workers are covered. Presently under ESI Act, self-employed workers are not covered. However, the Code on Social Security 2020 has covered all classes of employment and all classes of establishments. Social Security Code. Yeah, earlier there were around 17 to 18 labor laws. All have been amalgamated into 4 codes. One of the code is the Social Security Code, in which self-employed employees are also eligible for coverage. The implementation is pending because of a dispute by the workers' unions, and I believe that the government will take.
Is it something to do with the SRAM card?
Yes, the employees who are registered under e-Shram portal will be part of
You see,
that.
most of the time I am getting feedback from citizens that they are trying to get to the portal to get themselves registered. And they are finding it very difficult to do that.
Yes.
Why is it? Can you give any
I think that pertains to the Labour Department, which PMJ, Prime Minister Jan Arogya Yojana, it's a separate scheme run by the Department of Labour, not.
No, I was just
yeah.
contemplating, I was just thinking that could be in the coming months, we should hold some camps. And if you can help us in organizing those camps, to help the self-employed people to get this registration done. Because you see many individuals, like the person who helped me in my house, registration to the government, he has got covered. Now he has got covered, but he is not getting covered. How can we help that?
Sir, I'll take up this issue with my other colleagues in the Department of Labour, because recently we are having a coordination meetings amongst all the various departments under the Department of Labour. So that meeting is scheduled for next week or the first week of May.
You should invite FTCCI into those meetings. My suggestion. If you can.
I will take up that issue during that meeting and get it resolved, sir. And I'll get back on this issue.
Can you
Good
introduce yourself,
Yeah,
please?
good afternoon, everyone. I'm Satish, and I'm working as an insurance service provider for the last a decade or so in Hyderabad city. My question is to Dr. Atul Mohan, sir. Um, in India, sir, I would like to know from you what percentage of the hospitals has so far been given the NABH accreditation, and do you also have any goal as to, you should be reaching this number of or this percentage of accreditation by certain period of time as such?
Yeah, that's my KRA actually. You know how to. So if we run programs under three broad headings of accreditation, certification, and empanelment. Accreditation, we currently have 3,300 fully accredited hospitals, including Ayush setups. I believe we have a share of 95% of these hospitals. These are multi-speciality, more than 50 bedded, pan-India. I truly believe that. Data will prove me right. As far as the small hospitals are concerned, that number nobody knows. I think, sir, also, India.gov gives a figure of 1 lakh hospitals, 100,000. Rohini portal of IRDAI mentions 33,000 hospitals, right? So nobody has that clear number. But out of that small number, I believe they count every nursing home as also a hospital. We have about 11,000 hospitals under the certification scheme. And under the empanelment scheme, which we deliver on behalf of Ministry of Defence and Ministry of Health and Family Welfare, the CGHS and the ECHS, we have about 4,200 hospitals. There may be some overlap also in the small healthcare, but currently, so that is the figure. So nobody has a clear idea about a census of the hospitals in India, the definition of a hospital in India. So that also maybe somebody needs to take up. Yeah, but we aim for growth, and we have set ourselves a target like from 17,000 to 50,000 over next 2 years. That is our own target, and we hope that we'll reach that, and we are working very, very proactively towards that.
Good evening, gentlemen and sir. My name is Ankit Acharya. I am from Future General Insurance. I head the health claims business there. So taking on the point where the gentleman said and talked about the regulation. See, I think the point is we are all sitting here to look at quality and affordability. We are 5, 7, 8 large key stakeholders in the room, and we are talking about how do we come together. There is a basic fundamental question which I think is the elephant in the room. The reason why all the insurance fraternity is together here, because we have got a leader. That leader is IRDAI. The point of governance and regulation is not only to tell what to do, it's also to tell what not to do and what will happen if you don't do it. There also is a consolidation and a deterrence and a direction. Now the point is, sir, if we all have to come together, especially from the provider perspective, the biggest problem that we face is that we talk to whom? Do I talk to Apollo? Do I talk to Fortis? Who is that one person that we talk to, who is not only that person who is bringing them together, but also regulates them? Who is that central body to whom the hospitals will report into? Unless we have that central body, the two large stakeholders, the money payer and the cost generator can never be solved, sir. So what is the view of the forum, sir, on that perspective?
Well, I can answer that.
There should be a categorization. अभी आपने कहा कि numbers available नहीं है. There are varieties of the different numbers are there. So there should be a census of hospitals. Category insurance fraternity can survive either intermediary, because we are the main chain of the both insurance companies as well as the hospitals. So we need a categorization of the hospitals and a regulator of the hospitals, just like a IRDAI.
So both these questions are excellent. We developed such a scheme about 2 years back at the insistence of NHA. As you would know that NHA enrolls small hospitals, and most of the big private hospitals are not part of the ABPMJ. So they wanted like hospitals like Apollo, Medanta, Max Fortis also to come under, and their HBP2 also was very low. The health benefit package was very low. So NHA asked us to create a scheme. We created a scheme, submitted there, but then the Honorable Minister thought that the scheme, time may not be very right. But that future will also come. We are working on not only rating and ranking of hospitals, but also of the doctors, as somebody mentioned. Best doctors of Telangana, let's say. So that will also be there.
Thank you.
We already have that scheme.
Thank you very much. Thank you very much.
One question, one point.
Okay, let me answer then. Maybe it has answered your question.
No,
Just-
this is a different question for you.
Oh my.
Give me one after.
Huh.
Sir, with our friend from Arugeshwar again, don't think I'm attacking you. See, there is a reason for my talk. See, if awareness is created about cancer, 50% of the cases can be saved. Madam has been asking right from the first, what is the awareness you are creating? Are you joining us to create some awareness among people so that we can save some lives together?
Sir,
Suggestion taken, sir. We'll work about it.
Yeah, we'll work out. Very good. Because it's always work in progress. Anyway, what I want to answer is, you see, first of all, let's give a big hand to the participants who have raised excellent questions. Let's give a good hand. Because without those questions, this session would have been extremely boring. So let me first congratulate you all.
As panelists and members here, we understand.
Yeah, number one. Number two. You see, what I want to share with all of you is very simple. Is that, as we all know, because we all are part of the Indian Constitution, that health is a state subject. And the state is the regulator. It is simple. We have a regulator which is the state. Let's get that in our mind. That is first thing. The second thing you must understand is, after 20 years of struggle, way back in 2010, we got a law which is called Clinical Establishment Act. I don't know how many of you know about it, but there is a law. So the states were the overall regulator. Then we said, this will not do like what you asked. Who should I report to? How do I report? We brought in a law called Clinical Establishment Act. Today we are in 2023. 18 states have notified it. Not even single have implemented it till now. The bottom line which I am trying to convey to you all is, and this is what is the objective of today's and tomorrow's session is, increase your voice in terms of the frequency of your message, that we need immediately the Clinical Establishment Act to be made implementable. Now, before I must share with you all, otherwise it will not be fair on my part to not tell you all that why it is not happening. You all must know that. And most of you will know that also within yourself, but you don't want to speak, but let me speak. Because many things you can't speak, but I can speak. I have that liberty. And many things I can't speak, you can speak. Or he can speak, but I can't speak. But what I am trying to tell you is, what I can speak is, first let's understand that we all need to be accountable and transparent. There was no clap. Oh my God, there was no clap. We all first need to be accountable and transparent. That is the most important issue, and that is the objective of this which we are happening. I am very happy to see the dawn of, or what should I say, the icon of the medical devices manufacturers body present here today, Mr. Rajiv Nath. Wonderful to have you with us. You see, what I want to tell you all is that everybody, which is representing here in this 1 day's and 1.5 days conversation, everybody has got a power. Let's bring that power under one roof. And let's all speak together with one voice. Then only you can be heard. If you speak in fragmented areas and if you work in silos, you will never be able to achieve what we want to achieve. And if we want to achieve affordable health care, which is of high quality, made accessible to all without any discrimination, let's become accountable and transparent. Thank you very much. Please close.
A
You
big
can close it.
thank you to the panelists. Thank you for open heart acceptance that yes, awareness must be created and it's the need of the hour. And I am sure that all of you have accepted the submission and we must come together offline and work in the trenches along with FTCCI and the committee, working on this initiative and making the Vision 2030 a reality. Thank you so much.
Thank you so much, sirs and ma'am. Thank you all. I think that was a very insightful and intuitive session. Many questions which were answered and many questions which came up. But I think it was a very good session overall. And may I please request on stage Mr. Rajiv Kumar Gupta, President PB Fintech Limited, Policy Bazaar and Paisa Bazaar, to please come on stage and hand over the mementos. Thank you.
हम ही हमसे न लें, ऐसा कभी न हो, हम आपको दे दें, ले जाना नहीं गएगा। We're done with two very wonderful sessions. We now move on to our session number 3. The session is going to be on the role of intermediaries and technology providers to be more customer friendly. The session will be moderated by Mr. R. Balasundaram, Secretary General, Insurance Brokers Association of India. He is an experienced general insurance professional with over 3 decades of proven track record in the industry, also possessing in-depth knowledge of the Indian market, with marine cargo being a passion. May I please invite you on stage, sir. May I also invite the speakers, Mr. Lokesh Casey, Convener, Confederation of General Insurance Agents Association of India, currently Secretary General of Indian Federation of General Insurance Agents Associations. Mr. Sohanlal Kadel, MD Kadel Insurance Brokers Private Limited. Mr. Sohanlal Kadel, Director with Kadel Insurance Brokers Private Limited, is registered with the Ministry of Corporate Affairs. May I also welcome Mr. Srikant Charan Mudigonda, MD Good Health Insurance TPA Limited, Underwriting and Claims, Business Development and Key Account Management in the General Insurance sector. Mr. Rajiv Kumar Gupta, President PB Fintech Limited, Policy Bazaar and Paisa Bazaar. So, as an experienced executive director with a demonstrated history of work in the insurance industry.
So, good afternoon, everyone. It's been a pleasure being here, and given the opportunity of interacting with you all, and especially with my esteemed panel. So, at the outset, I would like to set the context right. When we talk about what we call about quality and affordable health care for all, insurance, health insurance is a subset of this. Let us not forget, so let us not confuse the issue, saying that all issues are directed at insurance companies, the intermediaries, the providers, the hospitals. Healthcare is overarching, under which insurance is a subsection. And now coming to the topic which we are going to discuss among ourselves is role of intermediaries and technology providers to be more customer friendly. So having made the initial distinction, the role of intermediaries and technology providers relates only to the insurance aspect, not to the overall overarching impact of healthcare provision. Okay, we also need to contribute to the vision of a healthcare provision for everybody, but that is a thing. But here, the part we are going to discuss is how can intermediaries be more customer friendly? So in all our discussions, the customer, I don't use the word patient here, I'm using the word customer, a citizen of India. How can we make it more customer friendly? So what is the answer? We need to understand what the customer wants. So my first question will be directed to all the panelists, beginning with you, Lokesh. In very crisp words, what does the customer want in terms of health?
So, thanks to the FTCCI for inviting me for this session. So if you ask me what will be the customer's delight, I can say in 3 phrases. Easy boarding, that's taking the policy. In time of need, the policy should be there, and policy should be there for lifelong.
Wonderful. How about you?
So the customer service or the customer expectations are normally into 3 parts. One is the pre-sales, one is the sales, and then there is the post-sales. When we talk about the pre-sales, probably the customer has to be explained, since we are talking with reference to or in context of the insurance, all the fine print, what is there, what is not there, what is the expectation, what are his requirements, how does it suit. Sales, so giving him the right product at an affordable price. When we talk about post-sales, where the role of TPS like me comes in, where we meet his requirements when he actually has a claim. Anybody buys an insurance only for the sake of a claim. So when he has a claim, at that point of time, are we with him or not? Having said that, customer service is, or customer friendly, is not being liberal. We need to be quick, transparent, fair, and just.
Just a slight twist to the question. It is not about what we have to do. The question was about what a customer expects when he buys a health insurance policy. First thing, what does he want? Like you said very rightly, he wants protection and prompt service in case of a claim. Definitely yes. And the third things to be explained to him, transparency or make awareness. Karan sir, same question. What does the customer expect when you go to sell him a health insurance policy?
No, customer, first of all, think that its rate or premium or cost of the product should be the lowest, number one. Definitely, any customer goes in the market, either the insurance or anything else, they will try to see that how to optimize the cost, number one. Second thing, a friend in need. The need for the patient having a policy, it is a question of his life and death. And he expects from the intermediary, either it is an agent or a TPA or a broker, that someone along with his family, someone should stand there at the time of he is in distress, and what possible help we can do. And it is happening also. Even our fraternity, they are going to hospital, attending the patients and talking to the particular staff of the hospital and doing, and this is expected, and we should be, as again I repeat, a friend in need. We should be a friend in need.
So I think agreeing to a lot of things which fellow panelists have said, the first thing what I would say, sir, the customer expects is transparency and integrity from the intermediary who goes to meet him. I mean, are we sharing all the facts which we need to share? Are we trying to actually understand what he already has, what his family has before recommending a product? And when he actually goes for a claim, will he face a rejection? That's the trust which he wants to, have from us, that as intermediaries, that please tell me what I should do correct, so that when I go for a claim, I don't face a rejection.
Especially for this, we have done a survey especially for this Health Vision 2030 conference. We have reached to more than 5,000 agents across the country, and we have got the feedback. Can we have the PPT, please?
So what are the top expectations?
Yeah, we'll go through, sir. There are only 7 or 8 slides are there. We'll go through.
It's come.
Yeah. Next slide, please. Yeah. So difficulties faced during marketing. This product information availability is not there.
Okay.
Then it's regarding very high premiums. The common question we face is about GST on health insurance, 18%, which is highest in the world. We have written to the Prime Minister, we have written to the Finance Minister, we have met several times Finance Minister. She has assured us that it will be brought down to 12%. But our demand is for everyone it should be 5% without any input tax credit, and for senior citizens it should be exempted.
Fair enough, Lokesh, I take all these points. I'm sure people would identify with all these points. The point we are discussing here is how can intermediaries or technology take care of these customer expectations. So the first thing is product information availability. Yes, we can definitely do it. We should do it. We are doing it. Very high premiums. I think that's a very standard question which Karan Saab also pointed out. मुझे कितना सस्ता मिलेगा is the question.
Sir, unfortunately,
There, does the intermediary have a role?
most of the time intermediaries explain to the client.
No, I'm just asking the public at large, saying that so intermediaries alone cannot pave the way for sorting all these ills of the customer. Like for example, is there a GST? That is something we can push as a body to the government. 18% is too high. We need to bring it down. But coming back to the basic point, high premium. It's a question of affordability, he says, and we are talking about quality and affordable healthcare for all. Remember the theme. Quality, yes, we saw in the previous panel discussions how they are ensuring quality, and we heard some success stories about limited areas where success has been achieved, quality healthcare at affordable prices. So I think the main maqsad of this discussion should be, can this be scaled up? Now, if an intermediary has to bring in a lower premium always, is it in his hands? It depends on the manufacturer, which is the insurance company. So I think you need to look at the whole problem holistically. An insurance company says, I can give you a good cover, but if I were to do that, I am a commercial organization, I need to make profits as well. So I cannot price it to suit the affordability of every Indian citizen, which is his state, which is right. Hospitals, when their treatment happens, they came out today morning saying that intermediaries do this. So we keep pointing fingers at each other. Now hospitals also, if they have to provide quality health care, they also need money. They are also a commercial organization. So the basic problem which needs to be addressed is balance between a commercial objective and a societal obligation. So coming to the next question, which I would say that the role of the other stakeholders become important. So what can we do when a customer wants only a cheap product? Lokesh.
And you complete your slide.
Yes, sir.
I want to see more.
Yes, sir. This PPN structure, most of the people are complaining about GIPSA and other things. Now, even in Journalists Council, there is a talk that there should be a common network, should be there in the country, where the entire industry will be having a common network, whether it's private companies or government companies. Then, sir, GMC bank assurance tailor-made policies, which is ruining the market, that should not be there. Then increasing in hospital tie-ups for more cashless facilities. I think now industry body is going to take a stand where the cashless cases should be around 90 to 95%. Next slide, please.
Lokesh, if I may play the devil's advocate here. If a bank assurance policy is cheaper for the client than what a broker can offer or an individual agent can offer, why will he not go with it?
I'll come to that, sir. I'll come to that. A bank which is policy they're selling at the bank, it's cheaper, I agree. But who is paying for it? It's the retail customer. Sir, if you go and seek the information through RTI with any of the PSU-GIC banks, PSU-GIC insurance companies, have they sold any GMC to banks? They say no, they have not done anything. What is the loss ratio? They don't disclose. The window dressing of this, all the balance sheets of most of the companies are happening. We know, everybody knows, everybody in this auditorium, especially insurance professionals, knows that GMC is a loss-making business. And in the parliament, CAG has placed this report. In last 5 years, PSU GICs have lost more than 32,000 crores because of GMCs. How long we will be cross-subsidizing this process?
Okay.
We need to take a stand.
Right. So what we suggested is the group businesses, questions will take at the end.
It's robbing Peter to pay Paul.
Please, Prashant, we'll take questions at the end. So the point remains here that health insurance business goes into two broad categories, as many of you know. One is the group health insurance, which corporates buy, and where the pricing is so flexible. For the sake of top line, insurers do use it, the cross-subsidizing it with the individual retail premiums. And individual retail premiums are standardized and you can change it only once in 3 years, 4 years, something like that. So the individual customer is at a distinct disadvantage. Very valid point. And now I'll ask the next question on this to you, Srikanth. Many hospitals, now we are not talking about the sales now, we are coming to the customer who has already purchased a policy. And I was one of them. So let me narrate my brief example. My wife had a small surgery, so I went to a hospital under a group policy. My employer had a group policy to begin with. So the cashless limit was sanctioned immediately, not an issue at all. But when I go to the hospital says you pay me a deposit of 25,000 rupees. I said okay, I paid it. Treatment over, next day. Hospitals take at least half a day for billing. And typically they ensure that you are discharged after 12 noon because of full days discharged. This is a fact. And I am speaking as a customer now, here, not as a moderator. So then what happens is, they take another 3 to 4 hours to collate all the documents and send it to the TPA. They say I have to collect it from different stakeholders and we have to scan it and send it. Okay, it went to the TPA and because I was under a group I could push it. The TPA also approved the amount within 2 hours. I got the approval. Then comes the surprise. The approval had some 20,000 rupees deduction. So at the time of discharge, hospital says you pay me the 20,000. I said, why my friend, I have given you a deposit, adjust from that and give me. He says, no sir. That I am retaining because the insurance company is going to pay me after 45 days. So that you should collect later. For this you pay the 20,000 now. Now my question to you, Srikanth, is, I, despite being in the industry and used my influence there, honestly, pushed it and got it into our. What happens to a common man with a retail policy in such circumstances? And the second question is, what does the TPA actually verify? When you are a network hospital, you have given the approval for an estimated amount. What is it that you verify? You verify only what are the amounts I have to disallow, is it not? So why begin on the negative note of disallowing? So how can we overcome this? How can we speed up the procedure? The moment the doctor signifies that the patient is ready for discharge, the discharge should happen within an hour. So where is the hitch? What is the problem you face from other stakeholders?
No, let us speak. We are waiting for
See, sir, this typically, I think most part of my answer you have already given. Okay, this yours is an absolutely exceptional case, but I talk about most common cases. In fact, most of that, what I'm going to say, you already said. Typically, in fact, I quote my own example again, similar to this. Very few months back, I had a bad fall. I was admitted to one of the top hospitals. Morning, the doctor is a good friend of mine. He came for rounds around 10:30. He said, okay, he's fine now. He can be discharged. 10:30. I was just fully waiting. And 2 hours passed. They didn't know who I am. So, like the way. So they said, no sir, we have sent a request to the TPA. They have not yet responded. I said, good enough? I said, good enough? So, of course, I checked with the concerned TPA. Of course, unfortunately or fortunately, that was not with us. It was with some other TPA, and all of us are friends. They said, and I checked my mobile, and you know, most of the TPAs, they have an SMS system. The moment they receive a request for the final auth, it has automated SMS triggers. So the moment it hits our mailbox, an SMS goes, we received your authorization. It's not a process, but it is received. I checked my mobile, it was not there. I checked with that lady, she was very nice. Sir, we are still waiting, sir. Now what happens, as Mr. Balasundaram rightly said, they first have to prepare a discharge summary. They have to go to the concerned doctor, get his signature. If the doctor is in operation theatre or he's in OP, etc., they wait outside for signature. Meanwhile, they have to collect bills from everybody, collate them, put them, and whatever their internal process. I'm not questioning that. They have their own, the way I have my internal process, the hospitals have their own internal process. It takes 2 hours, 3 hours, 4 hours, whatever it is inside, and then it goes to the TPA. 95% of the times, at least I'm quoting from my own example, my own TPS example, 95% of the time the final auth goes within 1 hour. Exceptions, why and all, there can be any reason. 95, they go in less than 1 hour. Now, the challenge here is the communication. Now patient starts getting disturbed saying that the TPA is not giving me authorization, TPA is not giving me authorization. So my request is that what we have to try to create awareness amongst people is when you get admitted into the hospital, please ensure that your own mobile number is entered in the cashless request form. Okay. Many times I saw that the message went, but the mobile number there was of hospital help desk. Patient is in dark, he is not aware. I'm not saying everybody is doing, but as someone said, there are a few black sheep here and there, or maybe the person who is entering did not have the number, whatever are the reasons. The moment this is there, wait, if you have not received within a reasonable time, any TPA, the message that the cashless authorization request is received, please follow up with the hospital why it has not gone. You can chase the TPA. I'm not saying that TPAs are always right. Every time they 100% they do within 1 answer. I'm not saying that there could be gaps in that. So this is the primary reason what happens. So your second question, what you said is, what do you check? So final auth, normally there will not be much of a checking. We just check whether what is given the initial auth, final auth, they are in the sync or not. Like first the request came for appendicitis, now hysterectomy is happening. That should not happen. So that is the first thing. Second, whatever final bill they have charged as per the tariff or not, are there any non-payable items? This is a simple check that is done, and so 95% of the times it will not, there will not be delay more than, I'm not talking about me, any of the TPAs, I'm talking about whole of TPA industry, because I'm part of the insurance industry for almost 35 years now, having worked with both public sector, private sector, I've seen everywhere. But it's more of a perception than there is a delay from the TPS.
I said, no, in fact, in my question itself, I prefaced it saying that I got the approval in time. That's not the answer.
It's not because you no, the common man.
So the primary question is, why should there be a deduction? It is a network hospital which has been approved by you. By you, matlab the insurance company taking care of all the things. Why should the hospital bill some unwarranted items? And why should you disallow them? One. Second question, if at all it is going to be there, like for a consumable or a doctor visit or whatever you call it, can we look at a smarter way so that the settlement happens instantly? So this question will go to Rajiv. Can technology help in mitigating this? Like real time I can scan and send the documents to the TPA, they can keep going. As and when the treatment happens, is it possible?
Sir, can I take a mic from you? most APIs today with insurance companies and large intermediaries are already integrated. You know, so whether it is applying for a policy, whether it is submitting a claim, everything happens through technology online, including a paper submission. Now, if your question is directly related to the question which you asked previously to him, that when you go to a hospital, why is that there is a rejection that this is not included, as a part of a claim? It's $1 million question which all of us have faced. I mean, including professionals from the insurance companies, including from people who are aware of this business. So this is something which is a top kept secret as to why accessories of used in the hospital will not get reimbursed. Why should it not get reimbursed when you are completely covered by health? So it is not about paperwork. All paperwork is complete, right? But this rejection happens in the last minute because you are in a rush to settle your bill and take your patient out. They say the TPA is approved, but this amount is not allowed. It's not there as per allowables, and that is something which I think collectively, along with the healthcare industry, the TPAs, the insurers and the intermediaries will have to find a solution together, because this is a problem which is creating the trust issue for customers, be it a corporate insurance, be it individual insurance, and that time even paying 10,000 from your pocket hurts you. See that why did I pay that premium then if I have to, pay this money from my pocket? I think that is a trust issue. And today biggest issue which probably the health insurance industry is facing is the trust issue. More than the amount of premium you pay, it is a trust issue that when I need the money, will I get the money back?
Just to add on the same point what is said, most of the deductions at the time of discharge are for the non-payable items and consumables, and which is typically a policy condition. And as you know pretty well, people start negotiating at the time of taking the policy. If blanket every policy covers these consumable items, absolutely no problem, all of us fight with the insurers and get it. But when there is a policy condition, these are given typically as add-on covers by most of the policies. While buying the policy, we all try to save that 100 rupees, 200 rupees, 500 rupees, and this I want the basic cover, that is enough. I don't want this consumables cover. But when a claim comes, I want everything under the sun.
This is not a blame game. No, it's not a blame game. The whole idea is, see, all of us sitting here are professionals. Some of them are representing the companies, some of them representing industries. But this is seriously an issue. Like in vehicle insurance, you have zero debt, right? You say that everything is payable. Something in the health insurance has to come out soon there, because people don't explain at the time of selling a policy that this will not be payable to you. Particularly when you buy GMCs, most of us are covered through GMCs to a certain extent. GMC doesn't cover, the entire. Somebody covers you 2 lakhs, somebody says 5 lakhs. But there again, a lot of conditions are probably not even explained by the company, nor does the company know at the time of signing the policy. They may be aware, but it is not explained to the employees that these conditions are, not covered in your policy. So transparency around why this is not getting covered. Is there an option to cover? For example, when I took my mother for a treatment for a hip replacement surgery, a number of consumables were not covered. To my simple question, whether the option was given to you at the time of buying a policy to cover that, the option was not given. It is not that the add-on was, somebody is not willing to pay 100 rupees, knowing very well that the 100 rupees could cover them the 20,000 rupees of consumables. So is the option available, number one? Are we offering those options? That's the question.
That is what exactly the point, that the sales have to be transparent first, and the person should know what is covered, what is not covered. That is what we talked about, the suitable cover.
Okay.
Having policy issued, the TPA cannot do anything.
Fair point. No, so this is not going to be intermediary blame game. No. So you are also intermediary, we are also intermediary. So, okay. Now, the award objective of the IRDAI, we are talking only about insurance here, health insurance. They say anything should be what? Affordable, accessible, and there should be awareness. So now we all agree in this panel that awareness can be and should be created by the intermediary. There is no two opinions on this. There should be transparency in sale, or in fact greater detailing, I would say, it is necessary. Awareness is one thing. Accessibility. do people not buy insurance merely because they do not have access to insurance? What do you say? Personally, if you ask me, I would say no. It is the trust deficit factor which comes to the fore. कल मेरा कुछ claim होगा तो मिलेगा कि नहीं? I have seen even in corporate insurances, CFOs tell me, boss, if I get 70% of my loss, I am happy. I don't want to get into a prolonged legal battle or anything to try and get my dues. I think as an insurance industry, all of us sitting here on the panel, I think we have not done enough on this factor. So the trust deficit, how do we bridge the trust deficit?
So the question is not about a trust deficit. The Indian mindset what we have got. If you are paying something, you should get back. That is the mindset we have got. If you have paid for health insurance for 4 years, 5 years, if there is no claim, if you have not taken any money from the insurance company, then he thinks, why I should renew the insurance? So this is most of the cases we face this. And coming to the question, trust deficit. So I don't think now that kind of trust deficit we have in the current regulations, with ombudsman in place, with so much social media in place, and TPAs are doing wonderful job. Even last 15 days back, there was a what we can say multi-organ failure patient was there. She was shifted from one hospital to another hospital. I got a call around 10:30 in the night. It was a Sunday. I spoke to the South head, and immediately it was escalated. Within 15 minutes, final approval was given. The patient was shifted to another hospital. I don't agree with that. There is no such trust deficit. But the awareness we need to create, and not only that, we need to put into the minds of the people that health insurance is not an expense. It's an investment what you are making for your well-being.
Do you believe there is a trust deficit between insurer and intermediary, intermediary and client, client and insurer? Like in the morning session, one of the panelists made a mention, and I concur with him. So, what do you say? Is there a trust deficit in the industry? Now, I think Rajiv also made that point.
I don't think I fully agree with Lokesh. Absolutely, I don't think there is any trust deficit. Major part I'm talking, here and there future cases.
Okay.
Typically, I just tell you one thing, the trust deficit comes in where something the person should get, he is not getting it. Yeah, something, there are two things. What I should get, I'm not getting. What I'm expecting to get, I'm not getting. There is a gap between these two. And having worked with the both public sector, private sector, now with the TPA, with working almost with the entire industry players, let me tell you on behalf of the entire industry, because I'm referring to a few comments made in the morning session, not even a single insurance company, let me underline, not even a underline bold, not even a single insurance company ever thinks of not paying any amount which is genuinely payable. I have not seen in 30 years any instruction from any insurance company, now working with more than 20 companies, either official or unofficial. No insurance company tells you, boss, मेरा bottom line बढ़ाना है, थोड़ा cut कर दो. Sorry, I've never received. This is a very honest statement I am making. And in health insurance, if you see, 95% of the claims get settled. We talk about 5, 6, 7%, whatever, I don't remember exact the industry number, claims get denied. The reasons are very obvious. Again, 1%, 2%, there could be some errors from some people like me, I may commit a mistake, but most of the claims are where the policy conditions are not adhered to, like the pre-existing diseases, non-disclosure of material facts, and so on, which are absolutely as per the policy terms and conditions. But the gap is between the expectation and what is actually available under the policy. Sorry, we will take.
Okay, we'll take the questions at a later point. Okay.
I just said a point first. I think probably we are mixing two things. The issue is not about the trust deficit for a customer who's bought a policy. So claims are getting settled. I think I fully agree and concur with all of you that when we sell policies today, the worry is not whether the insurance company will settle the claim or not. I think we are addressing a larger issue of penetration in this country, right? The health insurance penetration, why is it missing? What is the missing middle? Why are people not buying health insurance? This is not the question about people who bought and facing rejections. Facing deduction and rejection is two different things. I mean, whether I get a full claim, whether I've got a 20,000 rupees lesser than what I should get, that is a separate discussion altogether. The discussion here is the trust deficit is among common people in terms of should I buy a health insurance policy or not. That is the trust deficit I'm talking about, not the trust deficit about people who have bought a policy, will I get my claim or not. I think that claim settlement ratio is very well aware that the entire industry, every company doesn't want to bring a bad name of not settling the claim, right? But how do we take this trust back? How do we go back to the customers and say, this health insurance is important for you. If you buy, it will help you in the future. And experiences in the past indicate that 98-100% of the claims have always been settled. So that you don't go out of pocket when you really want to settle a high health bill in future. I think that is the trust deficit we're talking about.
To put it positively, what I call complete trust or blind trust is when we approach certain customers and ask them, "Aapka policy hai kidhar?" They don't even know the name of the company. They will say, "Sharma ji place karte hai na." They depend on the agent. Yes. That is the trust they have. So, insurers actually not only use the selling and marketing skills of the intermediaries, but also the trust which the intermediary brings. So that is very, very valid point. So, because when I moved from the government sector to the private sector and went marketing, we found it very difficult to break through. There was a Sharma ji, there was a Khanna Saab, there was a Gupta ji who was doing the insurance. Client did not know the name of the insurer. That was the trust. And now the trust is waning. That was a simple point. Okay. Now having said this, so we said that yes, awareness, intermediaries, it is their responsibility. We will create it. We do create it. Affordability, not totally in our hands. It depends on the manufacturer. And manufacturer also depends on his loss ratios. So he goes around. So it's a different circle or a different ball game altogether. The third point is accessibility. Well, an intermediary, we reach out to the customer. Like I said, we bring in the trust, we bring in the negotiation, we bring in the marketing abilities, everything. But we cannot reach everywhere because there is a cost involved in it and there has to be a return for that to me because that's my livelihood. So will technology provide the solution, Rajiv, of penetrating into far-flung areas?
So, sir, I think certainly technology has made a big difference, both in terms of cost rationalization. I wouldn't say distribution through technology is the only solution. I think all kinds of distributors are very crucial and very important for the ecosystem. Companies like Policy Bazaar sell policies through digital, mode, and I think that's a different market altogether. People who understand, digital, people who are comfortable getting their product understanding from, digital, will certainly buy through digital, and with minimum human intervention. But India is a large country. Indian ecosystem still requires large number of people to go and explain to the consumer why this is important, what are these features, because he is not comfortable reading the features on the screen and then deciding to buy a policy. I think that will always, remain in this country for many, many years to come. Your question about has technology helped? Technology has certainly helped. Technology has certainly helped to cut down paperwork, to bring down your expenses. So your product cost has also come down. But the major issue today is, you pointed out somewhere here while you were explaining this, are we classifying this country into different categories? Today the top is getting taken care, the bottom is getting taken care by the government to a large extent. But I think the middlemen, the middle class, which is the missing middle, we call it, in a favorite way, which is not probably getting taken care. Today, tier 1, tier 2 cities, there are distributors, be it online, be it agents, be it a lot of other people. Tier 1, tier 2, there's a lot of focus. But when it goes to tier 3 and tier 4, how many people are into this profession of selling, insurance to those consumers? So those consumers don't even know, where do I go and buy an insurance? Should I go and buy an insurance? So creating, that kind of model through technology of reaching out to tier 3, tier 4 cities will certainly help.
But gentlemen, we have no choice. We have to align with the government vision, health for all. And as I said, insurance is a subset of healthcare and we have to spread insurance. Technology helps, as you said, to a limited extent, yes. So what could be the way forward for healthcare? Is it a government insurance companies partnership with an excess layer of cover coming in from the insurance, whereas the primary covers all the entire population? Like for example, I would like the panelists' view on this very quickly because time is running out. Whether the Ayushman experiment can be enhanced, let's say to all Aadhaar card holders or compulsorily members in this program, up to a prescribed limit where they pay a limited thing. And it is not insurance, it is healthcare. So there is no question of a policy condition, pre-existing illnesses, etc., etc. And on top of it, if you want to go, you can buy a policy, insurance policy from any insurance company. But the underlying principle will be that whatever the limit under the healthcare scheme would be the deductible under the insurance policy. So that will enable the insurer to price it lower. Does it sound a viable model?
Sir, exactly Mr. Praveen, what he is saying, Obamacare failed. Again, health is a state subject. So center can't intervene. I would like to share a few things here. One, as far as intermediaries are concerned.
So your study is still yet not revealing what he has said.
Yes, sir. I requested them. Yeah, you can run through the show.
Go to the last slide.
So it doesn't work, you say, right?
Just go to the last
Yes, it doesn't work.
Okay, what about you?
I've got few suggestions there.
Yeah.
Even for the senior citizens, if government comes up with a scheme, just like Ayushman Bharat, for above 60 or 65, now this two schemes, this type of scheme should be there for senior citizens because the rate of premium every day is going up like anything. That's the one way. And already of the insurance industry, for the insurance agents, now the agents are confined to work with only one company. That also should be opened up.
I think that's a workable model. Typically up to a small sum of 50,000 or 1 lakh giving a basic cover. Why I feel it works is typically it removes the factor of adverse selection. Why the group policies sell cheaper? I am talking technically, whether undercutting or not is a different thing. Group policies work cheaper because of two things. One, the lesser cost of acquisition and reduced adverse selection. So if across the country 140 crore Indians are covered for a lakh of rupees, let's say I talk about in an insurance model, what is the coverage is a different thing. Today Ayushman Bharat policies typically work out for 5 lakh rupees, 5 lakh sum insured at 2,000 rupees. Okay, the packages are quite low and all is fine. We can rework, but for the BPL I think we can continue to do. For the APL BPM, we can give a base cover at a nominal premium and the insurance companies can offer a top-up cover on that.
In my opinion, it may not workable because in one country we have 29 countries and every state government, I have seen with my own eyes that one political party captured the power again because of the group medical policies. Now this is either one state is propagating and they want credit, one state wants credit, and even some of the Ayushman Bhavan, some of the states have not been implementing that because credit should not go X, Y to Y, Z. And today the first time I am on the platform I am telling that before this Ayushman Bharat, I am the person who took appointment from Mr. N.D. Nadda, he was the health minister. From Hyderabad all the way I went and told this policy you implement, it will be yield very good result. I don't take credit that it has been implemented because of me. But like you friends also can. But this is not practical. Yes, I can add that marketing arm should be strong. There should be now 34 lakh agents we have in the country. Some 600 brokers we have. So we have to work, we have to reach, and this country doesn't depend only on system. एक बार सामने बैठ कर उसको बताएंगे नहीं इसमें ये कवर है, इसमें ये कवर है, इसमें ये नहीं है, अब ये साइन करना. Till then our client won't be satisfied, and we are the sandwich between TPA, between the insurance company, between the client.
If any claim comes midnight, we have to leave our family and stand in the hospital, and we have to work like a doctor. Doctor sitting inside, we are sitting outside. We are working like that. So it is a very difficult job for intermediaries, but ठीक है, हमको भी survive होना है, and our client also should get. But so many things are there. Vejanti Mishra is sitting. I can hear. He should use his good office, not like this conference. Some 10 people in one room closed for 3 days and discuss with the IRD, because there are 33 companies having 33 policies every day. How we don't understand what type of policy, what covers. So how a particular unknown person can know about the coverage. So there is a simplification has to be there, otherwise it will be difficult to sell the policy.
So that concludes the discussion, gentlemen. I think I had a very important question, but then I don't think there is time for that.
No, this time. Go ahead.
No, they have given me an ultimatum. Okay. Now this question could raise a few eyebrows. There was an ad sometime in February, I think, a full-page ad in Hyderabad, which proclaimed that we are neither an insurer nor an intermediary, and we are providing you healthcare services. And now there are many, dime a dozen everywhere, different types of operations, health card membership, which gives you so many benefits, gym. Along with that, there is a tagged along health insurance also. What do you make of these entities? Should we not add the word, apart from affordable and quality, sustainable healthcare? Because these entities are never regulated by anybody, and they just operate. They proudly proclaim they are neither insurers nor intermediaries. So what are they? So Lokesh first, quick.
Yes, sir. Sir, now one more thing, which is nowhere it's regulated. Now, claim processing agencies.
No, first let's answer this question. Let's not jump the gun.
Yeah.
Okay, what do you think of these agencies? Like, I don't want to name them here in public, but there are plenty of them, we all know.
It should be stopped.
Stopped.
It should be stopped. They are misleading the citizens.
Sir, don't you give opportunity to ask at least one question?
Yeah, you can ask, sir. After the third,
We are waiting for moderator to ask us.
Just these are not sustainable models. I think regulators should look into these things immediately and take all necessary actions.
I think, sir, there is no debate on this, right? At the end of the day, such fly-by-night operators across industries exist. Not only insurance industry, you find them everywhere, They are there to fleece, people, they are there to cheat people. I think such people don't have a future. The only problem is, whenever somebody gets to know about them, please report immediately, so that people take action against these companies. Because by the time we take action, it takes few months, and by then they would have fleeced some crores and gone out of the system. I think that is the biggest problem in this country. Report. When we get to know, we report. I am sure each of us are responsible people. When you get to know, please report. That's the only solution.
So I think now we can take a few questions.
Daily panel. My name is Prashant Matre. I represent GRP as their president. Yes, this mushrooming of so-called health providers, claims counselors is there. I also understand that some of them are promoted by back-end ops of some TPS and ex-TPA persons.
Let's not get into
No,
who
let
promotes
me know,
as
let
a
me know.
concept.
As a concept, this has to be stopped in the bud, and it would have been very apt if a representative was IRDA was present actually for this session.
Not required. It's all getting recorded, they'll get it.
Second,
What is your question, please?
Second,
It is to which
whatever Shrikant sir said, I have my practical experience used to counter it, because unfortunately trust issues crop up because the TPS don't deliver in time, because they do not have adequately qualified medical staff. unfortunate fact, if I ask any TPA, 95 to 98% of claims come from the allopathic range of services. And how many allopathy doctors are there on board of these TPAs for the day-to-day? You have dentists, you have physiotherapists, you have UMS, you have BAMS, you have BHMS. All of them are qualified in their pati, may be very knowledgeable, may have excellent clinical skills. I am not denigrating them. I am just saying that they are not qualified to handle allopathy because my policy says that cross-pati is not allowed. So if cross-pati is not, if a doctor is not allowed cross-pati to treat, how can he settle a claim? Because why is he not allowed? Because he is not qualified to do that.
No, you're making a statement or asking a question.
And therefore my question to the TPA is, when are you going to come with adequate allopathy doctors on your panel to ensure proper processing of claims?
Okay, Srikanth, all yours.
My answer to you is very clearly, never. Because, because, just let me add, I think we are running out of time. It's not the cost, I am not talking about the cost. Cost is one factor. Cost, if my cost is not working, either I shut my shop or I ask more from the insurer. So cost is not the factor. Let me tell you, there are two factors I'll give you. One, a TPA factor, one is a national factor. When we talk about a TPA factor, a TPA is not allowed to deliver or render any clinical advice. The line of treatment, clinical protocols are 100% prerogative of the treating doctor. TPA cannot interfere. Now what the TPA is doing here is whether the particular whatever is given is as per the policy terms and conditions or not. And whatever claims deducted, and let me confirm, unfortunately don't carry it in my laptop, but otherwise I would have shown 99% of the claims rejected or deducted are due to non-medical reasons. 1% could be due to medical reasons, for which every TPA, like today, Good Health has got about close to 100 MBBS doctors. We have about 400 Ayush doctors. So we have 100 doctors to support and guide in case of critical things, and we have close to 50 specialist doctors are on panel. So one, I don't see any necessity of an MBBS doctor doing. These Ayush doctors all have studied the same unattended the medical terminology. They don't have to give the treatment. Just to add one more point, recently Mumbai government has conducted a bridge course for the Ayush doctors to allow them to conduct, I don't remember exactly what treatments and surgeries, because they believe 50 to 60% of the claims are medical management claims, not treatments, so they have allowed them. That is part one. So TPS will never come up with, and I personally feel we can debate it later, but I don't think doctors require.
One last question.
Sir, just one last addition. The second part is, as it is we have discussed, it's a 135 crore country. Many towns, villages do not have enough doctors. Why an MBBS on whom the nation has spent so much of money should leave a clinical practice and work with a TPA to do a paperwork? There's a question, I leave it.
Yeah, good thought. Sir, last question, sir.
I have one question to ask. See, so many insurance companies are mushrooming now. The marketing department is totally different from claims department. Marketing people give such a rosy picture and make you also sometimes tell, you say like this, then you'll get a phone call from the company. You say like this. This is a very unhealthy and unethical practice that is going on from the marketing department because they are given targets and they get their commission. How can you curb that? That's most essential. It is killing the industry. This is number one. The second question is, why only allopathic medicine is allowed by the insurance companies? Why not Ayurvedic and holistic treatment?
So that is a question which we need to address to the insurers. I would have been happy had an insurer been on the panel also.
I'm going to ask beyond sir.
Just to add, sir, almost all policies cover Ayush up to certain limit. 20% of sum insured, if I remember correctly, maybe other friends can, 25% Ayush is covered.
All policies there are different.
The only problem is it requires hospitalization, which Ayush mostly does not need.
Thank you, gentlemen. I think we should call it a day. I am very tired now. This has been a very engaging discussion. And, thank you very much. Thank you very much.
Thank you so much, sir. That was a wonderful session. May I please invite on stage Dr. V. Chaturvedi, General Secretary, Swasthya Cancer Care, to hand over the plants and the mementos, please.
नहीं आप लोग दे दो मैं वहाँ फोटो के लिए आया Thank you, sirs. Thank you so much. Thank you, everyone. We would now break for tea. So there's one more session which we have after a short tea break. We will break for tea for around 10 minutes. We will be back right here in the hall exactly after 10 minutes at 4:45. Thank you.
Want to delight customers with quality of our products. We should first do standard setting of quality. Consumer online foundation did it using this tool for complaint redressal mechanisms. Under ISO 9001-2015, service providers can plan, develop processes, create systems, face audit, get assessed, and avail certification. For IRDAI, this is an opportunity in waiting to implement ISO 9001-2015 and delight customers. Consumer Online Foundation did it under the leadership of Professor Bijan Kumar Misra. Bijan.
भाई तुम आओ अंदर आओ ऐसा बार फिर तो कैसा होगा घर वाले बाहर फिर तो कैसा होगा
Chava? Grish? Chava lela?
Back side on itu bawah. Atlo dulu. Ada tadi kan. Ayo. वो भी आ गया ले आ गया लंडन आ जाने चाहिए
You keep one for yourself. You use, tell the gist of it. I will say, Nirmala Devi, Nirmala Devi, Secretary of the something. So I say that Nirmala Devi was there, tell the details. Now this is most important case. First today I first I will write that you can counter me. Second.
चेहरा वाला दांडी टेबल के सामान डेली जाते गाड़ी चेंज करके आगे खत्म कर खत्म हुई तो कैसे सब रेडी
We need to work out a solution.
You know what? You spoke and then went away. You didn't give time to question. There were so many questions.
Insurance stand was vindicated. Number one is the insurer claim to justice allowed the claim by directing the insurer to process the claim and settle the claim. The government itself said talk and therapy is advised. After therapy with your AIG popularized. Yeah, that is what Trump took to USA. That was also prescribed for COVID. At that time, COVID, which Trump took and said, okay, So it became popular. So Nageshwar Reddy was popular. अंजना स्टार्ट करो ऑल देम मैं देख की टाइम को बढ़ा आई हैव टू गो अर्ली स्टार्ट करें
चाय हो गया सर
हम लोग तैयार है आप
स्पीकर्स तैयार है
पकोड़ा बात करो
शेखर जी सुनने वाले नहीं आए तो बात करने वाले आ गए
पकोड़ा बन जैसे अगर
हाँ
आप बात करते शेखर जी पहले ये थोड़ा हेजिटेट आई वांटेड हर टू स्पीक फर्स्ट नंबर्स पर आप थोड़ा तो 5 मिनट बात कर लेना जो भी आप पैनल पे होना इस पे बात करने का भी बाद में करना कि आप कर लोगे आप कर लोगे चलो एक साथ कर ले 5 मिनट Nirmala Devi has got you can speak little more 7 minutes for you can take those she got 7 cases of ombudsman where the grievances were 5 or 6 cases don't take this not read up just don't read up you write down points just go through that give you time you can speak to attend मूर्ति साहब आप पहले बात करते ओके आई विल इनवाइट यू फर्स्ट moderator tell from the senior citizens perspective how people suffered on the grievances आपका पर्सनल ग्रीवेंस कुछ था कॉल हुआ इंश्योरेंस के बारे में आपका पर्सपेक्टिव बताइए Pardon? 5 minutes maximum. 4 to 5 minutes is what we give. How many speakers? उसके बाद इधर उधर भी बोल क्या वजह से ये पेलों पे सिविल सर्विस आप पहले बात करते क्या मेडिकल डिवाइसेस दोनों में से मैं देखता हूँ कौन
He's the chair. He's the chair.
क्या बोलेंगे आप? What do you think? कुछ है brief lines about this.
About the speakers. They're displaying at the back. They're displaying at the back. You see on the screen. Thank you.
But I can't see from there.
You're talking about grievance handling.
Yeah.
I'm not talking about preventing grievance handling.
Preventive grievance
अभी आना सीखना है
Diagnostic. चलो पहले बात करो देखते हैं
And tomorrow he's there as a keynote also. Come, let's not delay. We will get late.
मैं 5:30 निकल जाऊंगा आप उसके बाद देख लेंगे क्वेश्चन आंसर
Come. वो come, madam.
Diagnostic
Come, come.
One liner about the panel speakers. You are calling up.
I'm calling out and give you, I'll give you
Sanjana,
online as well.
that video.
Okay. You will
tell him about the
No, but calling out, I mean,
Praful Bhai's video.
when I moderate, your role is not there. Your compare is not required. Give to me. Pass on to me.
Yeah, video first.
So I will use it for quick calling them. That your role is over. Yes, enough.
हाँ बोलेंगे ना. Ready, keep it ready. Let's just keep it ready. कल सब जाने वाले हैं. He will mention. ठीक है, कल सब चले गए.
कोई भी अगर कहता है, I'll just call them on stage.
Just keep the video ready. Senior citizen. So doctor, his name is not there. He's there. सर आपका यहाँ पर ठीक है सब अपन बताइए प्लान क्यों देगा अरे प्लान आप दे रहे हो नहीं अपन टोल नहीं अच्छा आप हाँ मेरा प्लान करने को आप फोटो दे दो सबको दे रहे आचार्य संजू
I bring greetings to you.
Good afternoon, everyone. This brings us to the end of the day. This is the last session which is being held. The session is on modernizing customer grievance redressal mechanisms and to assure customer delight. The session is held and it's moderated by Mr. B.P. Acharya sir, IAS retired chairman, Insurance Ombudsman Advisory Committee. Sri B.P. Acharya sir was the Special Chief Secretary to the Government of Telangana and Director General, Dr. Marichanna Reddy Human Resource Development Institute of Telangana. The speakers we have for this session are Mr. Bijon K. Mishra, IRDAI nominee, Executive Committee of the GI Council. Professor Bijon Mishra, International Consumer Policy Expert, is an honorary professor at the National Law University, Orissa, and Professor R&D, Northeast Christian University, Nagaland. Mr. Shekhar Agarwal, Chair, Health Committee, FTCCI. Shri Shekhar Agarwal, sir, Past President, Convener of Health Committee, FTCCI, Managing Director, Bhagyanagar Polymers Private Limited. Dr. V. Chaturvedi, General Secretary, Swasthya Cancer Care, Member of FTCCI since 2001 and Member Healthcare Committee 2023 and 24. Srimati S. Nirmala Devi ji, Secretary, Office of Insurance Ombudsman. We also have with us Mr. Rajiv Nath, Forum Coordinator, Association of Indian Medical Devices. Mr. Rajiv Nath is the Managing Director of Hindustan Syringes and Medical Devices. Vyasamurthy, EC Member, Telangana, All Senior Citizens Association. Sir, we would like to request Shekhar Agarwal sir to just hand over the plants to all the members.
So, we are all late members can start.
Yeah, please.
Ombudsman, very important, most important. Welcome. So, sir, right. welcome. So, Vijay Mishra sir?
No.
Huh?
I will. He's not accepting something. He wanted something bigger. A tree. He wants a tree. Professor Mishra deserves a tree, not a sapling. Good evening and welcome back to the session. It's a big challenge to have a session immediately after the tea break and at the back end of the day. You've had a long day since morning. So we have, as read out by the introducer, we have a very distinguished panel here. So I would, because of the time constraints and the number of speakers on the panel, I would request Professor Mishra to start with a video clip which is got on the patient forum, patient organization. I'm forgetting the name of the organization.
Patient Safety and Access.
Patient Safety and Access organization is a Baroda-based organization where the Vice President has himself made a clip on the issues. I think he's online.
Yes.
Okay, thank you so much for supporting this event, Mr. Seth.
Chairman Shri Anil Agarwal, Professor Bijan Kumar Misra, Shri Shekhar Agarwal, ladies and gentlemen, I bring greetings to you from Patient Safety and Access Initiative of India Foundation. Thank you for inviting me to this very prestigious Health Insurance Summit, Vision 2030, Quality and Affordable Health. I am delighted to speak on modernizing customer grievance redressal mechanisms to assure customer delight. Inasmuch as I wanted to be here in Hyderabad to participate in your deliberations, I am unable to join due to personal reasons. I am therefore sending a short video presentation. I have shared the full text of my presentation with Professor Bijan Kumar Misra. Let me begin by focusing on two important aspects: affordable health care and more specifically on quality. India was one of the early signatories for universal health coverage. It simply means we want to provide accessible and affordable health care to every citizen of our country. The second important aspect is quality. The United Nations Sustainable Development Goals 3 and 18 deal with quality assurance and access to medicines, devices and services respectively. If we want to delight customers through quality of our products or services, we should first do standard setting of quality we desire. Fortunately, we have a system readily available under ISO 9001-2015. It's easily doable. In 2021, Consumer Online Foundation did it using this tool for complaint redressal mechanisms. Under ISO 9001-2015, service providers can plan, develop processes, create systems, create documentation, face audit, get assessed, and avail certification. For IRDAI, this is an opportunity in waiting to implement ISO 9001-2015 and delight customers. Consumer Online Foundation did it under the leadership of Professor Bijan Kumar Misra. Finally, let me share a small case study. This study is about over-enthusiastic insurance agents and how they lure senior citizens for expensive health policies and dragging them for medicals when comes time and energy. Such practices are unethical, perhaps for the selfish purpose of earning commission, and should be discouraged. Based on my experience, I strongly feel a certified consumer complaint grievance redressal mechanism can avoid such issues and improve communication between company agents and consumers. Thank you once again for invitation and allowing me to share my thoughts.
Thank you, Mr. Seth, and thank you for supporting this event. You were one of the initial supporters, sponsors for this program. We thank you on behalf of the Federation for your support. Mr. Seth mentioned about the role of medical devices. We have with us Mr. Rajiv Nath, who represents the Association of Indian Medical Device Industry. As you would have realized, the grievance redressal and the medical devices are interlinked. In a way, medical devices, use of medical devices are there, as he says, to prevent grievances from that aspect. Mr. Nath, about 4 minutes on this topic, please. You could speak from here or there. Thank you.
Thank you. I thought there was going to be a video. Maybe I've taken that position over there. Hello everyone. We're talking about quality healthcare, affordable healthcare. Now that cannot be reaching anybody unless you've got quality medical devices to deliver that. And devices can be anything from a simple syringe, whether for giving a vaccine or for a therapeutic shot, to an MRI machine, to an X-ray machine, to a wheelchair, to a thermometer, to an oximeter, or even a simple mask. And more of you have got familiar with the medical device post-COVID now. The main issue that I wanted to bring and highlight over here is, we're talking about addressing customer grievances. That is the curative part. From manufacturing, I would like to focus upon the preventing part. If we don't have need for grievances, there is no need to redress them. So we have to bring in an ecosystem where we are trying to minimize the creation of grievances, where patients don't feel upset. You don't have cases like Johnson & Johnson where you've got implants coming in, they are corroding, and the regulator is not supporting you, and the patients have to create a union and go to the media and fight for their rights. That's not a fair position when the product already is under regulations. That could have been understood for the 6,000 odd medical devices that were not being regulated. Now, how many of you are aware that effective from this year, all medical devices are regulated? You cannot sell any medical device, you cannot manufacture any medical device unless you got at least a registration or a manufacturing license. You cannot import anything. Are you aware that you cannot even resell a medical device from now on without a proper registration? Are you aware that even a hospital who is a reseller of a medical device needs to get himself registered for selling that medical device? And if he is not, he is doing that activity on today's date illegally. Are you also aware that a hospital is many times reusing, re-sterilizing medical devices, repackaging them, relabeling them, in terms of making it affordable and cheaper for patients? And that activity also is treated as manufacturing, and for that he needs a manufacturing license. And if he is continuing to do that from 1st of April this year, he is doing it as an illegal activity. So the reason I am pointing this out is that because when such activities do happen under an unregulated area, you will naturally have more infections taking place. If single-use medical devices are meant for single use, are going to be used multiple period of times, where manufacturers have not advised their reuse and they're not designed for reuse, in terms of making it just affordable, if a doctor is reusing a syringe or is using an expensive catheter, whether it is a cheap syringe or an expensive catheter, it can lead to a cross-infection. It can lead to issues. So you have patients who come into a hospital for 3 days of treatment for a hernia. They get a hospital-acquired infection and they have to stay 1 week or 2 weeks or 3 months over there. And they're being pumped with antibiotics. So that is the hidden cost of staying in that hospital bed over there. Whereas you also know that now medical technologies have become so advanced, and even medical interventions have now become so advanced, that doctors claim that you can come to a hospital, come in the morning, go in the evening, or come today and go back tomorrow because they got the confidence. They're doing minimum invasive surgeries. And technologies and devices are available to help doctors and surgeons do those kind of operations, and those technologies are helping over there. So the question is, are the hospitals and the insurance providers seeking that the hospitals and the products that they are using are quality products. They're coming from certified manufacturers. That certification is coming from QCI, NABCB accredited certification bodies. Are they having the Indian certification for medical devices, ICMED certification? And are insurance companies giving an extra point to the hospital when they are certifying them to a NABH accreditation or whatever? Are they also doing that on the basis of the procurement practices and the medical devices that they're buying based on quality, not only on price? Because if not, then you have a sieve and there will be leakages. And those leakages means poor quality products come through, it means corrupt practices come through. And that's where we need to have either voluntary certification systems, robust procurement practices, or you need to have regulatory oversight. So, this is important that insurers, in behalf of the patients, are able to insure through hospitals and ensure that whatever is coming in, the quality is being checked and the whole supply chain is being built for that. Are they also checking that the technologies that are being used, they have undergone a health technology assessment, and the health technology assessment has proven that this is a safer and a more cost-effective way of giving therapy? So these are all benefits which are available to patients in terms of public health care. And public health care does not only mean public health care in a government hospital. Public health care also means public health care in a private hospital. Public is public. We also have to question that the hospital impaneled underwriters teams, third-party assessment people, the claim settlement teams, how much are they well versed with quality, medical device certification and regulations? If they are not, then they will not be able to take care of patient safety concerns and protect patients over there. And once again, like I mentioned to you, if the quality is not good, it means other procedures, other issues, and then you are spending extra time on the hospital bed over there. Are they also aware that the whole market is flooded with products having false certifications and false logos? So you must have seen when you're buying masks, there's a US FDA logo on the box. There's a CE marking prominent logo on the box. Now in most cases that's completely unauthorized. US FDA does not permit anybody in the world to put the US FDA logo on their packaging. If anybody has it, that manufacturer is misleading, he is not having that certification. He will not be permitted to do that. And if he is putting a CE mark, he also has to put the CE mark number, so that by that number he is traceable to the website of the CE certification body, and you can have a linkage over there. If that number is missing, that means he is again misleading the consumers over there. And it's this kind of misleading packaging and certification which is happening unregulated in the country. All this fake certification proliferation, which becomes a demotivating factor for the actual manufacturers who actually have earned the certification. So they're sincere manufacturers who have actually earned the certification, and then people in the market will say, yes, certificate ka koi fayda nahi hai, you can just buy them anywhere. So this becomes a slap on the people who actually have worked hard, and the teams and engineers who have worked hard to earn that certification. Same thing like hospitals, who are the sincere hospitals who got accreditation from NABH, for example, or JCI. Are you also aware that on today's date, I'm just finishing. Are you also aware that hospitals and insurers in the area of digital health, that even software is a medical device and that needs to be regulated and currently being regulated? And if hospitals are using software for clinical evaluation, they also are covered under that. So if anybody is operating a hospital without doing that, is doing that illegally. So as insurers, be aware about that. The government has a policy for localization and indigenization of medical devices. So we hope that insurers and the hospital systems are taking cognizance of that and giving advantages to that. So Niti Aayog and the Parliamentary Healthcare Committee and our association has been recommending for quite some time that for patient safety, you cannot have medical devices regulated as drugs. We're not medicines. There's a need for a separate medical device act. That act can have many facets for protecting patients, giving quick access to innovative products, because you cannot have clogging of access to medical devices under the new system now, because while we have a rule book for the manufacturers, it is parked under the Cosmetic and Drugs Act, and that is going to be limiting access of innovative medical devices to patients. Also, the problem still remains like Johnson & Johnson. If something goes wrong, how do you get compensated? Ethical manufacturers don't mind compensating. They don't mind being wrapped on their knuckles. It's better than bribing somebody. It's better than looking the other way and trying to fool the system. So let's have a system or a law that can be implemented, which is implementable, like the FTCCI Act, where you have an act which is mostly decriminalized and you don't have fear of complying with the act. If for every act, most people are going to be non-compliant, it becomes a bigger issue. So patients and manufacturers and insurers and hospital providers need to work as a team, like was being discussed earlier today. And we are along with that to work along with you and to listen to you. Thank you.
Thank you, Mr. Nath, for giving us an overview of what is the latest regulation on the medical devices. In fact, during COVID, we did face such problems very frequently, where the complaints about masks being reused, the PPE kits being reused, doctors were at the wrong end of the such products. There was a shortage in the first phase particularly. So thank you for apprising us about that. Next, I would like to invite Dr. P. Vyasamurthy. He represents an interesting group of people, group of association of people called Telangana Senior Citizens Association, which the grievances mainly come from this kind of group. I would like him to highlight what are the, from the senior citizens point of view, what are the possible grievances and how we could serve them better. Thank you. You can speak from there or as you like.
That gives me a chance to hide myself.
4 minutes, please.
Good evening, ladies and gentlemen. I won't take much time because I haven't come totally prepared. Okay. Yeah. So I'll give a couple of points which I have noted. Some of them may or may not be correct because I have not been keeping up to date myself on this topic. I don't know whether mental health is covered under health insurance or not. No.
It is now covered.
No. Oh yes.
It has just got covered.
Yeah, my information is 2020. I am very happy to know that. Yes. The waiting period for pre-existing disease varies from 1 to 4 years. Has it been reduced? I do not know. Some companies, I learned that there are about 5 or 6 companies giving special offers for senior citizens. Whether they all of them follow some standard rule, I do not know. Then most central government health insurance schemes like PMJAY or other things are for BPL category, and now something has come for APL also. How effectively it is going to be implemented and how people would benefit by that, there is a lot of awareness creation to be done, even among the senior citizens and communities. Who will do that? There are questions to be answered. Then the cap on entry of age at 80 years is most favorable schemes. This must be uniformly made to, I request, to 85. Is there any company which is entry age of senior citizens for that? If you got insurance right for a long time, continuation is easy, but fresh is very, very difficult. They would, at one point in time, I remember it was 72 years. After that, you can't enter into the at all. Okay. Then now I believe that Ayush and Siddha and homeopathy systems are also included in healthcare, health insurance. I do not know whether it's how effective it is, and we had our speakers talk about it also. Renewability of life should be offered in all cases for senior citizens crossing a certain age. I don't know whether it is feasible or possible. That is my wild suggestion. Then, insistence on medical examination must be done away with are included as a part of the premium itself. The first premium can be high, subsequent renewal premiums can be affordable, so you can include that in there. But these are wild requests. How far it would get into the minds of the people, I do not know. Practical issues of portability, transfer from one insurer to another must be addressed. Then daycare procedures, cataract and all that, not requiring hospitalization, we just walk in and come out, should also be covered. Okay. So as I confessed in the beginning itself, I am not quite up to date on this topic. Whatever a few thoughts which I came to mind, I have written and asked for.
Very good.
Yeah. Then Mr. Chalikani Rao was talking to me yesterday. He had a thought that senior citizen associations and federations of senior citizens associations must take up the responsibility to either collaborate with the insurance industry or start some schemes of their own, because they can gather a large number of people. For example, if you take about Federation of Andhra Pradesh Senior Citizens, they represent quite a few lakhs of seniors. So they have a wide group of people to whom they can offer. Or insurance company can tie up with federations and through them make all the members insured persons. So that's a good idea. And instead of they should start the medical schemes of their own, in which case they will be tailor-made. They know the requirements. It is not that some insurance company thinks that this can be given and they start off. From the consumer side, if initiatives are taken, it will be much better. So I don't have anything more to say. Thank you so much. Right.
Thank you, Mr. Vyasamurthy. These are very relevant issues. In fact, if you list out all other such issues and pass on, please back in. Mr. Shekharji, I will tell you how we can take it forward. In fact, I represent an advisory committee which is set up by the IRDAI to look after the grievance redressal mechanism and to revamp it through the insurance ombudsman. Professor Mishra is also part of the committee. I am the chairperson. He is the member. Professor Rawat from IIIT, he will also be joining tomorrow. And Professor Venkat Chengavali. 4 of us are there in the committee. We, from time to time, we recommend to IRDAI what are the ways and means to revamp the system. The 2 reports which you have sent, how IT can be applied, for instance. There is a new portal which is now called Bima Bharosa, where, of course, it has to be popularized, the scheme, on par with what RBI is doing for the ombudsman for the banks. So that is where offices like insurance ombudsman become important. We have an office of Hyderabad insurance ombudsman. Unfortunately, the insurance ombudsman is away today. He has deputed the secretary, Mrs. Nirmala Devi. She's got a few case studies where cases where the awards were passed, the grievances were redressed by the ombudsman on the health insurance side. She will briefly tell about that. So, and as and when suggestions come, we would like to take it up with IRDAI to see where rules have to be changed, where the companies have to be sensitized. It is happening in for instance, the amount which was the limit was earlier 30 lakhs, we have recommended to increase it to 50 lakhs. The amount was 1 year, the period limitation was 1 year, we have now recommended to make it 2 years. Such procedural improvements we are planning also, apart from IT application, so that it becomes more user friendly. When you call up, the theme of this conference, the theme of the session is delighting the customer. I remember Professor Mishra talking about his experience with the American Express card, where he calls up the helpline and he is delighted by the response. His model is to make it as delightful as that. We are all trying to make it as delightful as that. So Mrs. Nirmala Devi, the secretary of the Insurance Ombudsman's office in Hyderabad, she will give you a few examples, case studies of the awards passed. Up to you. You would feel comfortable there?
Good evening to all. Actually, as Sir told, our main purpose here is about modernization of grievance redressal mechanisms, but initially we would like to share a few examples of some cases which we have dealt with. And I agree with Mr. Rajiv Nath when he told that it is always better to prevent grievances from arising rather than trying to solve them after they have arisen. I have one or two case studies with me. One was of a naturopathy treatment where the insured was admitted in an Arogya Alayam, a naturopathy center for treatment of osteoarthritis, varicose veins and lumbago. The hospital bill was for 25,000, but the claim was rejected by the insurer, stating that the treatments received in health hydros, nature cure clinics, spas or similar establishments are not covered. The claim for naturopathy is actually restricted to 25% of the basic sum assured, and the admissibility of the claim depends on the very fact whether the treatment was for the same ailment or for some domestic reasons. In the instant case, it was for ailments. And besides, this Arogya Alayam was also accorded referral status by Health, Medical and Family Welfare Departments of Government of Andhra Pradesh. In order to meet the ends of justice to the insured, the forum allowed the claim by directing the insurer to process and settle the claim. This was one case, and there was a rejection.
What is the amount in what?
25,000, sir. And there was another rejection of claim for bariatric surgery. In fact, we get many such cases in the Ombudsman office. We have chosen a few only. The insured was admitted in the hospital for management of obesity. Claim was rejected, stating that bariatric surgery can only be allowed on cashless basis. The insured person was unable to lose weight through traditional methods and was advised to go for bariatric surgery by a qualified surgeon. While deciding the complaint, the forum observed that the hospitalization and surgery are not disputed by the insurer. Hospitalization and surgery not disputed. The forum, but they were willing to pay only if it is cashless. Then the forum opined that there was no restrictive condition for admitting the claim only on cashless. There cannot be a restrictive condition. Therefore, the rejection was set aside.
Forum means the insurance ombudsman's forum.
Yes, the office, the insurance ombudsman. Then there was a partial settlement.
How much amount?
That was amount I have not noted.
Okay.
Yeah, bariatric surgery means it will be slightly high. Yeah. Then there was
very common now. These days it's very common.
Yes, sir. Then there was another rejection of robotic surgery reimbursement. The insured was admitted for robotic right-sided partial nephrectomy, hysterectomy, oophorectomy procedure. The total medical expenses was around 6.6 lakhs and the claim was settled by the insurer for 2.5 lakhs, saying that the policy condition specifies a sublimit of 2.5. The forum what we found was the robotic surgery is an advanced medical procedure which reduces human intervention in the surgical process. But the insurer's partial admission is not reasonable because there are many other allied expenses also. It is only the procedure that has been taken as a robotic procedure. There are many other allied charges like OT charges, room rent, doctor's consultation charges, pharmacy bills, diagnostic charges. All those were included within this 2,50,000 capping for the robotic surgery. Hence, the claim was advised to be, ordered to be admitted. Then there was another case of cocktail therapy where the insured was covered under Mediclaim, and he had undergone immunotherapy, monoclonal antibody as injection. The claim was for 75,000, disallowed by the insurer. The person was aged 68 years. Was not given as per the and this treatment is actually not as per the choice of the insured, but it is a decision of the doctor and considering the age and medical conditions of the insured. And the insurer's contention was that it is authorized only for specific usage under emergency usage authorization. The medical needs and necessities of the senior citizens are to be given priority and empathetic consideration, and considering that the forum ordered settlement of the claim. So, like these are a few instances where we have, the Honorable Insurance Ombudsman has paid, directed the insurer to pay the claims. And as we said, it is actually better to prevent the grievances from arising rather than coming to the Ombudsman or any other forum For that, in our experience, we feel that a lot of things have to be done for raising the awareness of the customers, not only about the, of course, awareness about the availability of forums like Insurance Ombudsman and other grievance redressal machinery like consumer forums. Everything, awareness has to be there, but beyond that, the primary awareness has to be about the basic insurance as such. Like many of the people do not know the importance of their signature in the proposal form. In most cases, we find that it was the agents who have advised them not to disclose a pre-existing disease many non-disclosures happen only because the complaint goes to the agent finally, but there is no use. Is it not? Actually, the signature is given by the proposer means he is taking the responsibility for whatever he has stated in the proposal. And like coming to the grievance redressal mechanism, as a grievance redressal mechanism, the advantages are not only that we are providing a relief to the customer, but also it forms as a part of an educative mechanism where the orders of the or awards of the ombudsman can be used as an educative input for raising further quality of underwriting or even product design. And our center has we deal with life insurance complaints, health and general insurance complaints, but we find that more than 55% of the complaints we receive pertain to health insurance. And on receipt of a complaint, our first step is to go through a process of mediation where we take up the complaint with the insurer for resolution, and it is when mediation fails that hearings are conducted and an appropriate award is passed by the Honorable Ombudsman. Then we are happy to say that many of the insurance companies have responded proactively to our mediation efforts, due to which we were able to resolve a good number of complaints, around 43% of our health insurance complaints, through mediation. So we take this opportunity to thank all stakeholders for their cooperation in making this possible, because mediation efforts reduce further litigation and ensures a win-win situation both for the customer and for the insurer. That's all I have to say presently.
Thank you, Mrs. Chandra Devi, for giving us a flavor of what an ombudsman is doing and can do. In fact, that is the biggest challenge we face today, that awareness about ombudsman is not much. Their office is right here in Lakdekapul area only, Masaptang. But very few people know the location, they don't come. In the entire the state of Telangana and AP, only 2,000 complaints per annum come there, where it is only the tip of the iceberg. Many people perhaps don't know that there is an institution like this. So our effort now in the last 2 years would be to see that like to leave. I have an official function on the National Civil Services Day. Today is the National Civil Services Day. I have to attend that officially. So I would request Mr. Shekhar Agarwal to take over and conduct the meeting. There are 2 speakers left. Yeah.
Sir, 2 bullet points if you allow me to.
Yeah, please go ahead. There will be a detailed Q&A afterwards, after all the speakers.
Because
Merely.
you are concerned with
Yeah.
the Ombudsman's office.
Correct.
Bullet point number 1, Ombudsman limits should be raised to 50 lakhs.
Which we have already recommended, as I mentioned.
Second, there should be a representation made by the office of the Ombudsman to the government or the competent powers that in certain standard cases, the decision of the Ombudsman should acquire the status of stare decisis. That is a law, that if a cataract claim in Mumbai city is payable for 50,000, no further questions, the award is given. This would as everyone.
In fact, you reserve such questions till the end. Mr. Professor Bijan Mishra, who is also part of the committee, he will answer, and she is also present here. So I will seek your indulgence to leave this panel discussion, because I have to attend. Program is actually starting at 5:30. I will join late.
For your presence.
Thank you so much. Thank you, Sekharji.
Thank you very much, Acharya sir. It was a great support for this whole event. Now, may I request Professor Bijan Mishra ji, the chair, to kindly present a small memento on behalf of all of us. To Acharya sir. Round of applause. Thank you, sir. So now we left with one minute. Can we take the question? We'll take. You'll give enough time. This is last session. And Bijon Mishra ji promise you that we can be here up to night 12 o'clock. So, so yeah, and purposefully he has kept this session the time he is there. So, it's okay. So here we have got Dr. Chaturvedi. He was former director of NISE, and very dedicatedly and with passion he is serving the cause of cancer. And it's a very old friend of ours, but it's very inspiring to always meet him. And now over to Dr. Chaturvedi sir.
Thank you so much.
Actually, in his each and every breath, there is he sees and tries to solve the issues of cancer.
Yeah,
okay, very passionately he does.
Good evening, friends. I don't take much time, but let me tell you a little background. You know, there should be a cause for any action, right? Without any cause, nobody will do. Today is a special day where we should talk about this. 2030, every family is going to have one cancer patient. This is what World Health Organization comes out with. I do not know how the insurance company is going to give insurance, especially for cancer, for people. We go to villages and talk to them, and we'll be able to really help in seeing that these small amount policy to cover cancer should be taken up in a very big way. Let me tell you the background. I'm a cancer survivor myself. 2016 I got colon cancer. 2014 my wife died after 10 years of ovarian cancer. Right? I have two sons who are settled in the US. I stay in India only for servicing people of cancer. We go to rural areas, talk to people about cancer. This is what I was telling even when the team was talking about. 50% of the cases can be saved if we can really create awareness about cancer. This is something. We take a team of doctors, screen them for breast cancer, oral cancer and cervical cancer, which is very essential. These are the three major cancers in most of the developing countries, in India and Telangana as well. And till today we have covered about 6,000 women and about 50 villages we have covered. And we also give orientation to youth on tobacco, alcohol. Then we talk about menstrual hygiene, physical hygiene and problems of human papillomavirus. That is a big topic which probably we should have a seminar separately. HPV is something that causes oropharyngeal cancer and cervical cancer. That is the main thing. It is sexually transmitted from men to women and it takes 20 years for it to grow. By the time they realize, they wouldn't know what they have done 20 years back. This is the most unfortunate thing. We should be able to be aware of it. And we started an NGO known as Swasthava Cancer Care, for which the chief patron is Mr. Mohan Kanda, who was ex-chief directly affected because of cancer. So this is what we are doing. And next year, we are taking up in a very big way. Thank God, in 2 years' time, Novartis came and then they started funding us. This year, I'm going to get another 4 or 5 organizations coming forward to fund our projects. Now, there's a big concern. I'm 75, right? And I never remember that I'm a cancer survivor. But the insurance companies are making me get reminded of it. This is the misfortune. See, 3 years back, I was paying only 40,000 rupees for my 20 lakh insurance. Suddenly they made it double. The reason that is given looks so irresponsible. They say claims are more, that's why we are increasing. You reduce your number of salaries, remove your increments for 1 year and reduce your staff to half, and then see why do you make a person who is 70-year-old to suffer again? Where from does he bring? How many people get pensions? I don't get any 1 rupee pension. Where from do I pay? 80,000 rupees for my insurance. That is one part. Adding fuel to the fire, 2 days back, I received an intimation. See, there is an insurance, Andhra Bank and United India joint insurance. This is known as, the Arogya Dan.
This is known as Arogyadan, right? I don't know whether you call it Arogyadan or Arogyadan. You know what happened? I'll tell you the reason. I received a message, dear customer, we regret to inform you that we are withdrawing Bank of India Arogyadan policy from 6th of March, and it will no longer be available to you for renewal. You may please contact United India if you want. This is a message that comes. I do not know how many people, there are at least about 1 million policyholders like this. I don't know how many people really died of heart attack because there is no life coverage. But somehow my heart is strong. I am still alive, standing in front of you. Luckily, yesterday I received one message from Federation saying that there is a group that is formed in the lighter vein. Please take it easy. The group's name was HIV. Right? And it was a shock to me. I immediately started looking at my policy, whether HIV is covered or not. Whether I should join that group or not. Finally, it is this seminar that has come up today. Okay, so let us see that HIV does not come near us. Now, see, this is what happens. This enhancement, I sent a mail to Ombudsman. No response. Absolutely, totally no response. I am sorry for saying it, ma'am. Totally no response. I even informed Bijon Mishra sir. He has been a friend of me for the last 20 years. No response. Mishra sir said,
no response.
देखेंगे. बाद में बोले, अरे, it seems there are too many claims here. That's why they have increased. Now, is it an answer to me? How can you reduce my 80,000 to 40,000 so that I am more comfortable and I can continue to live a quality life?
Sir, 20 years back you should have met advisors like us.
Sorry, sir?
20 years back you should have met advisors like us.
Anyway, I mean, I want to...
And to add to that, just 1.5 or 2 years back, when Andhra Bank was merged, they came out with an increased rate at that time also.
Yes.
Same Union Bank and same United India.
So the banking institution has become like a stone in the blind man's eye. Blind person. हाथ में पत्थर है, कहाँ फेंकते कोई जानता नहीं. This is how things are happening, and it is playing with lives of people. That's what I am more worried about. I want to see that it stops with me and nobody else will be affected because of this. Now this is what I wanted to share with you all. Kindly find out a new policy if required with a low premium only to cover cancer, because cancer is going to be rampant. It is not going to stop. In coming 10 years, the number is going to double.
Sir, cancer care policies are there, but the premium is quite...
Sir, only Life Insurance Corporation of India came out with a policy. I don't know how much.
Other general insurance companies and standalone health insurance companies are providing standard cancer care policies.
Sir, if cancer care policies are there, where it is reachable by a common man, kindly let me know. When I talk about awareness in a village, I talk to them. Go in for this policy, pay only 10 rupees, so that you are covered for 1 lakh. Something like that. Whatever. I'll be too happy because I'm a wanderer, I move around. Okay?
Cancer policies
Yes.
at reasonably affordable rates for people in the Mufassal areas in the right age group.
Yes.
Where you are right and where we are wrong is we are unable to reach there.
Sir, I will reach. I will take you there. I promise to do that. Entire Telangana I move around. I talk to rural people. My life is only in the villages.
Okay.
I'll be too happy. Join us. Let us join hands. Sponsor some programs. You are all people who have been corporate. Sponsor some programs. Funding. We will do it.
We are individual agents. We are fighting for the senior citizens also, sir.
First class. Wonderful.
We are fighting for senior citizens premium also.
Great. I'm so happy about it.
GST and stop the premium rising after the age of 60.
Excellent.
We are continuously fighting the
But sir,
insurance companies, sir.
see, I am traveling to US to see my children. I went to United India, asked them for travel insurance to be given.
Chaturvedi sir.
They asked, only 1 minute, let me complete this. I asked for travel insurance. They asked me my age. I said 75. Sorry, we are not giving. Now, this is the fate.
Sir, they are not giving because you talk like 57, not 75. So, thank you. So, I think before we go ahead, Vijayji has got some points to make.
No, I don't have any points. He mentioned my name, that's why I had to come. Okay, now listen to me. I heard you. You better listen to me now. You please listen to me because I heard you. Each and every word I heard you.
Thank you so much, sir.
Okay, very nice. You're doing a great work. Please carry on. See, what I want to tell you is, nobody is ready to cook the food and feed you. You have to cook it yourself. And that's what I've been doing for 40 years. You see, I'm teaching people how to cook. Because what I want to tell you is that he gets away saying that I told Bijon Mishra, but he never came back to me. He never came back to me. He might have been telling me on the elevator or somewhere that I have got this. And he expects me to retain that and resolve that without any details about what he's talking about. So what I want to tell you all is where we go wrong.
I appreciate it.
Sir,
let's look at the sponsors. What do you read? Have you ever seen a sponsorship coming from a patients group and a consumer organization? Never. Have you ever seen? Never. And why? So what I want to tell you all is, and I tell especially my consumer friends who are into the consumer movement and people like Mr. Chaturvedi, who is propagating, treatment for cancer victims. It's a big job managing resources to mobilize resources in India. Let me tell you that. Because the people who are earning from you, who earn profit out of you, they can spend that money in whatever manner they want without your consent, which is your money. Why are you so quiet? You should react to it. You see, the point which I am making is, in this country, people use your money, people keep your money with them, but they don't want to spend it for you. So what I want to tell you all is, till you don't raise your voice, you will never be heard. If Bijon Mishra is being heard, it is because I am not scared of anybody, because I am talking the truth, and I am talking the truth on behalf of you, because if you are not speaking, I am speaking. You see, my only issue is that you can't get away telling Ombudsman doesn't respond.
That was 3 years back, sir.
No, I'm coming to that. I'm coming to that. You see, the Ombudsman was not responding because we were found sleeping. If we were alert and if we were awake, the Ombudsman dare not go to sleep. And that is what we call Jago Grahak Jago. You heard that campaign? Yes. Whose money got used? Your and my money. 100 crores every year, yours and my money got used to bring that campaign into the forefront in the country, which is today one of the most successful public spirited campaign supported by Government of India. And do you know how much of your money is still lying, yet to be utilized to get you educated and made aware of? More than 8,000 crores. That's only in one place. We have got agencies like Investor Education and Protection Fund. We have got unclaimed money of the insurance companies lying with the regulator to promote for senior citizens. Have you ever approached the senior citizens? Have you ever approached IRDA to find out what they are doing with that money for senior citizens? You have not. I'm sure you have not.
No, I have not.
No, I'm asking of the senior citizen representative. That's what I'm saying. You are aware? You are aware, but you have not asked. The best tool to us today is the right to information. Nobody can deny you. Learn to write questions which will get you answers from the right places at the right time in the right manner. And that is why we are having this deliberation.
But they are not giving proper information in that year.
No. Again, that's a very relative term. If you talk to me in Telugu, I will not be able to understand. Please. What is not right for you may not be right for everybody. Not be right for everybody. They are answering you something which is what they can answer you. Okay? But if you are not able to understand that, it is you who has to ensure that you understand in the language you understand. You see, I went to UK to study Citizens Charter. I was supported by Government of India to go and study Citizens Charter. क्या देखा वहाँ? In Telugu, they are publishing Citizens Charter in London.
Wow.
Can you imagine? Can you imagine? I asked them, why are you doing it in Gurumukhi, Bengali, Telugu, Tamil? Bola, we have citizens in UK who only know this language. Now what I am trying to convey to you all is, we print so many literatures, but we never realize for whom we are printing, does he know to read that language? We never realize that. We spend crores of rupees, 20,000 copies printed, distributed. To whom? To people who don't need it also. People who need it, we don't communicate in their language. And then we'll end up saying, आपको तो 20 साल से बोल रहा है, आप सुन ही नहीं रहे हो हमारा बात. अरे यार, हमको वो भाषा में बोलो जो हम समझ सकेंगे. आप हमको उस भाषा में बोल रहे हो जो हम समझ नहीं पा रहे हैं. आप 20 साल को 40 साल तक बोलते रहो, हम नहीं समझेंगे. So what my contention is? So my contention is very simple, friends. I am not finding faults. I am not criticizing anybody. What I want to tell you all only is, as we are all working towards only one goal, that is, no citizen should create a debt or sell their assets to access health care. Okay. I want to see in Telangana, that's my desire, my dream, I do not know. 43 years I spent in Jamshedpur. People, when I started moving to Delhi, after 43 years in Jamshedpur, they said, दिल्ली में क्या करेगा तू? हमारा जो जमशेदपुर में कर रहा था वही करेगा दिल्ली में. 27 years I spent in Delhi. People asked me, अरे तुम हैदराबाद जाके क्या करेगा? हम बोला वही करेगा जो हम जमशेदपुर में किया, जो हम दिल्ली में किया, अभी हम तेलंगाना में करेगा. So what I am trying to tell you is, what I want to do is that let's start from my colony, from my association, from my group of people, from my community. Can I give them universal health coverage? Let's start from my home. Like I have covered my children, I have covered my wife, I have covered my person who works for me in my house. I have done that for myself. I am well protected. Now look at your neighborhood. Fortune Towers में सब किया है कि नहीं? Universal health coverage नहीं किया. कौन-कौन नहीं किया? क्यों नहीं किया? Let's ask those questions. Why haven't you done? The whole objective of this whole exercise which we are trying to do today and tomorrow morning is only to ensure how Telangana can show the world by 2030. Not a single person in Telangana will ever say that I am getting worried how I am going to get treated or who is going to give me the help in terms of my health care. And then we will say with one voice that we will all do it together. होगा कि नहीं होगा? होगा. Fantastic. Thank you very much. Maharashtra waits for you, sir. Whole India waits for you.
well said by Professor Mishra ji. See, you remind me, Churchill was there in the UK, and one convocation he was invited as the chief guest, and big gathering there, he didn't turn up. Then again he was invited, that he took 2 months time, again he didn't turn up. Then again postponed, again after 2-3 months again he invited, then this time he turned up. And then he was seeing, every time he was checking how many people again and again they come back. You know, he used to have a hat and a cigar and a stick. And they removed the hat, kept the stick. And this was his very important speech, what people were expecting. And everyone was listening, keeping their eyes and ears, everything open. And it started. First message is, never give up. Second is, never give up. Third is, never give up. So, on the floor, we understand that lot of medical devices are still importing in India. And even the COVID time, the oxygen concentrator, everything. So, it's a major challenge. Government of Telangana is also promoting medical device part. So, how much time will it take India to become self-dependent in the medical device, or not depend on single country import? Anything you would like to share on that?
Sure. So India depends upon 80% of its medical devices from overseas. Even a simple thing like a hot water bottle we are importing.
It's very, very important for us to understand, yeah.
And why we are doing that? We have misled ourselves in trying to be affordable, we've not become Atmanirbhar. So we've been importing the products at either 0% duty or 7.5% duty. So even existing manufacturers stopped making or expanding their production because it was cheaper to import under their brand name rather than to put a factory. So manufacturers became traders. 20 years back, 30 years back, the distributors used to become, well, they are reasonable. You can't build expressways and then put 60-kilometer speed limit sign if the car can go 120 kilometers. So let's be having something which is realistic and changing times.
Thank you very much. Certainly you must be taking it through yourself, and your association must be taking it with the government of India and the state.
Yes, we are, but there is a huge, very strong imports lobby which does not allow this to change. Forget about medical devices. Do you know the Secretary of DPITT, Department of Industrial Trade Promotion and Internal Trade, how many secretaries have changed in the last 3 years' time? Anybody who comes forward and is a passionate Big India person, what the PM wants. The PM wants this, but it's not happening on the ground. There is a very strong imports lobby which will change the person. Not only in medical devices, it's happening in many fields. So we'll talk about Make in India, but it is mainly being, in many product lines, being lip service, not actually happening on the ground.
So the solution is FTCCI. You have to come to FTCCI and then be able to create a kind of a noise which is from all the stakeholders and not seen that it is being driven by the industry.
You are very genuine, Rajiv, and
your political leadership over here is excellent. So they are fighting on behalf of Telangana government for the success of the medical device park to become a life sciences.
Yes, what Bijonji is telling on behalf of you, we can also represent, and we have got Delhi, FICCI is there, and so we have also got the relationship with them.
Collaborative efforts are definitely is going to help.
So, but a good cause, and all of us will do it. Thank you.
He took the time.
Certainly, we'll also like to promote to our members and others. Normally, how much time does it take for getting a patient award or?
The time limit stipulated is 90 days.
90 days, okay.
90 days, but most of the complaints we have settled within 1 month.
That's very good.
That is what we are trying every
very good,
time.
Very good.
But sometimes it
and it's
takes
certainly, we can understand.
But as per rules, it is 90
90 days, but you are doing it 30 days. Yes. Right. Congratulations, madam. Good job.
I thought you should mention is what ombudsman service has been given. You don't need a lawyer. In fact, you cannot have a lawyer. And you don't have to put any money or any fee, it is free.
Totally
free in the sense that government tax is using taxpayers' money to give you this service. So please use it to its full. And also, it is now being heard online. You can sit at your house and lodge a complaint
and do it without any paper. Am I right or wrong?
Yes, sir. Actually, what I thought was it is an initial round, and I thought of talking about those things in the second round.
Please talk.
Actually, I would like to,
Please tell them.
yeah, yes, sir. I would like to tell that the rule, as per rules, it is 90 days, which is the time limit for settlement. But more than that, it is the most cost-effective, fair, impartial mechanism. And there are, like, whichever way the complainant feels comfortable, he can give a complaint, lodge a complaint. He can either walk into the office, he can send by post, his complaint by post or by email, or online facility is also there. www.cioins.co.in is the website of the Council for Insurance Ombudsman. And if the complaint is lodged in the portal, it will be registered in our office, and we will be solving it. And hearings are also conducted online for the convenience of the people. Direct hearings are also conducted wherever the person requires. Some people insist on coming to the office and, so that they want to see the ombudsman and have a direct hearing, then that is permitted. Otherwise, online hearings are also done. Even from abroad also people can attend the hearing. So that's, yeah, yes, sir.
There's a question there.
Can we have the, yes sir, yeah, please.
Mike, please give the mic to him. Somebody please give the mic to him.
Sir, one thing, I'll just come to you. Then once we'll start, we'll come open house, then we'll have an open. No.
Sir, I am Dikshit from CADCO, Confederation of All Telangana Consumer Organizations. Sir, one short question to Madam. Madam, if one in health insurance, one consumer won the case in district forum, that insurance, Aditya Birla Insurance Company filed appeal in state commission. Can we approach you or not?
No, sir. As per rules, if the complaint is pending before another forum or already dealt with by another forum, we cannot entertain as
because the state commission is looking after 2016 cases. Ours is 2018 case.
Who told you to go there?
I have not gone there. That insurance company, Birla Insurance Company gone there, appeal for appeal.
No. First of all, you should have lodged a complaint to the ombudsman. Why did you go to the district commission?
Insurance.
I have not gone there, sir. Yeah, that insurance company gone there.
He's saying after the order was passed, the appeal went to the.
No, but order got passed by the consumer complaining, na, before the district commission. Yes or no?
Yes, first initially we won the case.
So you thought you won the journey and the victory total, na?
Oh, thank you very much, Dr. Vyasnayanji. Now here the thing is, you spoke very well, and we like to have more senior citizens representation so that Bijonji can address your issues. So whatever senior citizens associations are there, if you can get connected with federation, that's coming everybody. So that will be taken. Okay. So now.
Don't worry, 12
okay. Just I like to, everyone all. So here we have got Mr. Sukumar sir. See, there Hyderabad once, Shroff Memorial Hospital is there at Kachigura, and that's a trust hospital, and Sukumar sir is the chairman for the hospital, and not he is but he always like to be very humble and keep a low profile. But he certainly got a lot of knowledge on the thing. Sir, very briefly, what healthcare, how we can take it for more affordable, and also insurance, what we can do from the insurance point of view. Can you just share? Mr. Sukumar.
Mike Sukumar.
Actually, I wanted him to be in one of the panel, but he always wanted to say, you always want to keep a low profile. Let's challenge it. Sorry, please.
That's special forum.
Special forum.
Thank you, Shekhar, for the very nice introduction. Actually, Madam has beautifully expounded the role of Ombudsman. Ma'am, we run a multi-speciality not-for-profit organization, basically meant for lower income groups. It's a 175-bedded hospital in Parkarpura. One point I've noticed about these insurance companies is that they are very unfair to alcoholics. Very unfair. Because, see, drinking alcohol is not a crime in India.
No.
And in fact, alcoholics are supporting the governments like anything. Many governments will simply falter if alcohol is banned. So now the problem that our patients are facing is, our people have insurance for 2 lakhs, 1 lakh, 3 lakhs. Now they come, most of the insurance companies said alcoholic liver disease excluded. There are many liver disease patients that come. One attender will come and say, the duty doctor, he does consume alcohol. We do not know what alcohol he consumes, how much he consumes, nobody knows. That is enough for insurance companies to say, sorry, we will not entertain the claim. So one of our patients, like Bijoyji rightly said, won the case at the consumer forum. Then those guys are not sympathetic. They went on appeal. It's a small claim, some 3 lakhs or something like that. They went on appeal, and that is pending for 7 years, 8 years. So this is where I think, okay, as you rightly said, you may not have a role. But at least in ombudsman, I think you should show a lot of sympathy to alcoholics against the insurance companies.
Apart from alcohol, do you got any other challenge which you think can?
No, we will.
Apart from alcohol, any other?
The other point on insurance.
Where other patients can be served.
The point. See, the biggest. See, we operate on a cross-subsidization model, which means we charge 1 rupee in the general ward for ward charges per day.
Please, it's very disturbing. Can you please keep quiet? It's very disturbing.
Yeah, we charge 1 rupee per day in the general ward. Okay, we charge reasonably in the 2,000 rupees in a deluxe air conditioned deluxe room. When we go to insurance companies, they come and tell us, you are giving treatment at a low cost, why should I give you higher tariff? This is being very unfair. I am doing out of my charity 1 rupee per day for a general ward. So what is the logic behind comparing that and say that you will not get good tariff comparable to other hospitals in a deluxe room? This is grave injustice being done to trust organization.
So anything Bijonji or Madam would like to?
No, my simple question is, our constitution says very clearly that there cannot be any discrimination.
Right.
Very clear, okay? Now, if you are a victim, you have to represent before the right authority. The right authority is IRDAI.
Yes.
You have to write to them.
Right.
That I am being discriminated like this by the insurance companies.
Right.
So they will either change the law,
True.
or they will tell you, sorry, I can't do anything for you.
True.
Now, when they tell you, sorry, I can't do anything for you, then you have a very good evidence to go and disturb the High Court and the Supreme Court and tell them that, look, I have come under a public interest litigation. I have not come on behalf of my hospital. I have come on behalf of the public who are being discriminated and not been given reimbursement in the manner it should be given. And I am telling you, this is my experience of my 40 years, I've got orders from the Supreme Court and High Court to direct the regulator or the lawmakers to make laws which are in the interest of what you are saying.
So, Bijoyji, you are a fighter, and I know you have a lot of success stories around you. But my constraint is the time. By the time...
No. Today, you see, the whole world looks at India as the best outsourcing
country in the world. Whatever America can't do, they will look at India to make them do. Our Indians stay awake in the night and work for America. You see, what I am wanting to tell you, that what you can't do, please give it to the people who can do. And part with some money for making that person do that, which you don't do. You see, the point is you want to keep all the money for yourself and you want to do everything yourself. You can't do it.
Mr. Sir, I'll tell you. First thing, it is a charitable, it is no money. Number one.
Again, let me tell you. No. Everybody gets away like that. You see, charity does not mean you don't have money to give sponsorship. This is also charity.
I have not gone for sponsorship.
So what I am trying to tell you, if you are doing charity, you should be the first person to take money out of your charity to bring a court order which will not discriminate such people who are alcoholics. That's all I am trying to tell you.
Okay.
That's all I am trying to tell you.
I think alcohol thing will take offline. Other thing, Professor Mishra has, now we go for the permission of the panel, we go to open house, a lot of our friends are waiting. Sir, yeah, we'll start from here. Sannyasi, now I'll come to you, right? Yes, sir. Just give me 1 minute.
Sir, to the
very short and crisp.
To the point
many of our friends can be.
Mr. Shivkumar was telling.
Yeah.
See, alcoholic and a social drinker, or they have to measure how to give the claim or read. He had one glass of beer. Claim is still pending. I have to go to the ombudsman after I reach Bangalore. So they have to study what it is like. Alcoholic means if it's a insane alcoholic, they have to prefer the claim like that, or he's a social drinker. What it is, they have to study that.
Right. Thank you.
Yes,
Thank you.
So they have to have something, some body to do that.
Very good. Right. Sannyasi, just short and sweet. Always you are.
I'm sorry for coming late because I have misled about the date. Is the Indian government is really interested in the lives of old people? I'm telling you one thing. See, I have tried my best to make an insurance policy after I crossed 70. The only one organization is giving insurance more than 70-75 is Star Insurance Company.
Which one?
Star.
Okay.
The founder is a military man. That's why he is concerned about that. So what happened? Recently in our place, a group formed and they have taken our insurance policies. I request you, this forum should recommend other insurance companies, other companies, they can charge more premium. They cannot deny the right of living in this country.
Don't tell more. I'll tell you later on. Okay. Okay, right. Sir,
Very good point.
Yeah. 1 second.
I have two questions. One directed to Nirmala Garu. Ma'am, is it possible to include the creating awareness about ombudsman in the policy itself? When the policy goes to the customer, if you can give a little bit information how the customer or the consumer in this case, that's one looking at. And the second thing, if our president GF, because I represent GFE here.
What is that GFE?
General Insurance Agents Federation Integrated. And I wanted to collaborate, we as GFE wanted to collaborate with Mr. Murthy Garu in creating the awareness about a health insurance for the senior citizens. There are so many organizations now available. One gentleman has just told that it is only the Star Health. But now there are a couple of companies which have come forward. Even at 90 years they are giving the policies.
Very good.
But there are certain limitations are there.
Can you disclose the name? Because that's useful for us. Because I would like to live up to 95 years.
There are, sir. I'll give you the first of that. Care is one thing which is giving that. Star is giving that. Niva Gupta is giving that. Okay. Okay. Now that's what I'm saying. I don't want to name the companies here. It's not my intention. Creating the awareness for the senior citizens about the health insurance products available to them at a minimal cost, at the best possible cost. Sir, if our President permits, I am ready to take it up. Thank you. Thank you very much.
Madam, we like to.
Why will your president not
Yeah,
permit?
yeah, please, please.
Mr. Prashant.
Sir, regarding
Why is the president not going to permit?
Sir, he's speaking what the forum on the dais wants. And we are there with all our hearts and resources to serve senior citizen community in the best possible
How
way.
many heart you've got?
A lot, sir. A lot. And I'm also a senior citizen, by the way, sir.
Very good.
Sir, 60 years is not senior citizen. World Health Organization.
Sir, Government of India gives me half ticket, sir. No worry. So my request, a couple of things I just wanted to add quickly.
Please, please.
Prevention is better than cure.
Yeah. Absolutely.
Prevention is better than cure.
Are they telling you
Why can't the insurance companies be
even now?
You are
Even
still
today.
there. So then insurance ombuds and in-house ombudsman or an in-house third-party grievance redressal says there are 2,000 complaints in Hyderabad, but in cities like Mumbai, Pune, where
It's much
almost 50% of all India health insurance is underwritten in these in these zones, and they attract the maximum complaints. One more thing, like consumer law, the claimant should be allowed to file a claim wherever he wants to file it from,
So it is
which
coming.
is not being done. I have seen it in several instances where people,
Now it is changed. Now it's changed.
see, this is just 3 months back.
No, they can. Madam, please.
Bombay Ombudsman Office has flatly refused people from Thana saying that they should go to Pune.
No, not now.
They refuse to accept. And
It is
therefore, the next suggestion that there should be, I don't know how feasible it is to have a, because someone says the regulator said there should be an insurance company in each district, so there should be an ombudsman in each district.
They are planning that.
Okay, sir.
First question was
No.
regarding
We are running against time. Yeah, madam.
Sir was asking about how policy can be used as a mechanism to spread the message of ombudsman. Actually, every insurance policy has got the address of the insurance ombudsman, and it is very prominently displayed also. And what we feel is even before
Last.
even before approaching the grievance redressal machinery of the insurer, they are approaching the ombudsman. That is true. That is the truth. And second thing is, sir was telling about grievance, another ombudsman in insurance company. Actually, they have 2 escalation levels of grievance redressal.
They are lip service.
That is true. For that we.
This is the office. You go there. There is one person. I'll look after.
So
it.
that is
He's
where.
gone for some other thing.
That is where they can.
No, not in the last 6 months.
So that
You are
is.
talking about before 6 months.
So that is where we have.
Now
to,
it has changed. If it not changed, you tell us.
Okay.
So that is where I want to tell that having institutions or having rules is not enough. There are 2 levels of grievance redressal officers in every insurance company, but what we find is that all the replies are auto-generated, and when your complaint is noted, your complaint ID is this, you can kindly wait for this many days. All those things will be there, and finally second reply will be, if you are not satisfied with our reply, you may approach the insurance ombudsman. That is the general reply we have seen in many of the complaints. Of course, there are some people who do respond also. I am not discounting their sincerity. That is one thing. Then
That is the picture of salt market.
then third question, let me complete the answer, sir. The third question was about ombudsman, people being able to approach from anywhere. Actually, from anywhere they can approach. As per the insurance ombudsman rules also, they can approach, they can give a complaint at an ombudsman center where the branch of the insurance office is insurance company is located, or where his residential area falls. And we have received some complaints where the party, it was a Hindi person, he was not fluent in any other language, but because he had an address in Hyderabad, some other ombudsman center had directed him to Hyderabad. But we talked to him, we had his mobile number, we talked to him and found out which is comfortable for him. Then he said the other place is comfortable for him. I think, if I am right, it was Haryana. So we directed him to that place, and we have sent a mail also to that ombudsman center that we had talked to this person, and he had informed us that your center is comfortable for him to deal with the complaint. So anywhere in India we can have, it is only dependent on the convenience of the customer.
Thank you so much. Thank you. We have last two questions. Please, there. One minute, sir. 1 minute.
Good evening, everyone. My name is Srinivas Rao, and yes, sir. Companies. And my question is to Nirmala Devi, madam. So, you are referring to 47% of the cases actually getting resolved during the initial stages. So, I would like to know 43%. Okay. So, I would like to know in favor of the customer or the policyholder primarily. That is first part, and the second part is as somebody. While taking the insurance policy, if somebody is mentioning that they are a socially alcoholic, or I think I'm audible. Yes. Yeah. So. Okay. So if somebody is mentioning that they are socially or responsibly alcoholic, and while they have mentioned it, if the insurance company has accepted the proposal, so do they have or do they stand any chance of actually rejecting a claim? And if so, what does the ombudsman state about this?
Again, sir, I couldn't get it.
Right. So while during the initial stage of application, the proposal document, so the insurance company, the customer mentions that he is socially alcoholic, okay, whether by whatever ways, and if the insurance company is accepting that particular proposal, so even if there is any chance of the claim occurring because of liver cirrhosis because of alcohol, or even because of any other reason, so does the insurance company, why does the insurance company reject the claim? And in that case, in that scenario, how does ombudsman take this case from there on?
Normally such a case will not happen because the first and foremost duty of the proposer is to disclose his medical condition and his habits, or whatever family history, whatever is asked upon the proposal form. And if these are disclosed, normally the insurer will not reject also. And supposing he had disclosed and then the insurer had rejected, then the ombudsman normally, because it is the decision of the Honorable Ombudsman, normally I can say that it will not be, the complaint will be allowed only.
However, in health insurance policies, liver cirrhosis falls into a permanent exclusion.
But still the opportunity was given to the insurer, no? The proposer had disclosed everything truthfully, and it was for the insurer to decide whether to accept the proposal or not, and having assumed that risk, the ombudsman orders the insurer to accept the risk.
So, okay, that means that the ombudsman takes it in favor of
the
applicant, the
complainant.
basically. Because just because it is mentioned in the permanent exclusion of the policy, so usually the insurance companies go against it.
That is true, but if the proposer has done his part, then he is not at fault.
Okay, and how about the total percentage of the claims?
Total percentage, if I remember right, I do not have the statistics right, around 79 to 80% is in favor of the complainant.
Thank you.
Thank you, Shivan. This side, if anyone is there, otherwise I will come. Okay, sir, here.
Yes,
दो क्वेश्चंस हैं
क्यों डरा रहे हैं हमें को डरा क्यों रहे हैं
बंदूक पे दो गोली है
सर ombudsman ने ऑर्डर पास किया but insurance company is not honoring that order. What policyholder can do? Number two, if a policyholder is not able to represent the case in ombudsman, can I represent on behalf of the policyholder? Why it should not be allowed?
Yeah, first of all, as per rules, the word of the ombudsman is binding on the insurer, and 99.99% of the cases are being complied with by the insurer. there are examples, very, very few only, where the insurer has approached the court, appealed to the High Court against the award of the Ombudsman.
No, they didn't get.
Uh-huh.
They didn't go.
Then you please let me know which is the case and then we will check.
Madam, in this case, we would like that the government be forced to pass a law which says an ombudsman award, once given and if not honored, should be treated as
a contempt case.
Not just a contempt of court, arrears of land revenue, and therefore the property of the insurance company can be attached.
I am not competent to answer that question.
This is not China, yeah.
ऊपर जाना है ना तो चांद की
China नहीं है.
तो पहुंच जाएंगे.
This is a democratic.
Is reminder made to the ombudsman, insurance companies, head office, even central government, even state government CM, he orders is not compliance by the insurance company.
Which
After
ombudsman?
that, Jaipur. Jaipur.
Okay, if it is pertaining to our ombudsman center, please let me know, sir.
I will give you example.
Jaipur, what I don't understand.
Sorry?
What happened in Jaipur?
जयपुर में सर पॉलिसी होल्डर के फेवर के अंदर में ऑम्बड्समैन ने अवार्ड दिया, बट इंश्योरेंस कंपनी के सीआरएम तक ने उसको डिनाई कर दिया कि आई विल नॉट एक्सेप्ट दिस. उन्होंने 90,000 रुपया कैटरेक्ट का ऑपरेशन का पास किया, ऑर्डर दिया है 95,000 का, बट सीआरएम कह रहे हैं कि नहीं है. उस केस को 90 डेज के बाद भी इंश्योरेंस कंपनी की तरफ से ना तो वो हाई कोर्ट में गया ना कहीं आगे उसको फाइट किया. पॉलिसी होल्डर ने
पॉलिसी होल्डर ने क्या किया?
पॉलिसी होल्डर ने सब जगह लेटर लिखा है, मेल्स लिखी है, इवन ऑम्बड्समैन को दोबारा लिखा है ये कंप्लेंट.
कितने साल पुराने केस है?
अभी सर विद इन 1 ईयर,
आप प्लीज भेजिए.
मैं आपको
भेजिए.
मैं आपको दूंगा सर.
भेजिए, मतलब सच्चाई से भेजिए, ये नहीं कि भेज दिया.
मैं आपको अभी दे दूंगा सर, मैं आपको
Hello.
अभी दे दूंगा. एंड सेकंड,
Hello.
Okay. On behalf of the policy holder, I should be able to find on behalf of the policy holder because I knew each and every terms and condition of the policy. Or any policy holder is not.
Okay. You see, one small clarity. One minute. One small clarity which I would like to give to you all is that there are cases where ombudsman has given an award.
आपका हो गया सर.
And the insurance company has gone before the High Court and brought a stay on that. Okay, there are instances which is not tenable, but कैसे होता है हम आपको बताना चाह रहे हैं. और क्यों होता है? क्या होता है कि even the judiciary which is sitting and giving an order, I hope I am not getting recorded anyway. Even the judiciary which
everything is recorded.
You see what happens, they do not know the existing laws of the country and they accept the case. Whereas if somebody would have represented before the High Court saying that they have no right to come before you because the law says this, as far as the ombudsman is concerned, is final, then the court would have taken cognizance to that. The poor person, the policy holders, they are unable to represent their case before the High Court and they come to know only after the notice has been served. So what we need to do is that in order to fight such insurance companies, एक तो सबसे बड़ा जो आपके पास हथियार है जिसको हम कहते हैं सूचना का अधिकार. नहीं सूचना नहीं, वो जो ब्रह्मास्त्र जिसको वो बोलता है, सबसे बड़ा हथियार है. वो क्या है? नेम एंड शेम. पब्लिकली बोलो कि ये इंश्योरेंस कंपनी से दूर रहो, क्योंकि वो सुनता नहीं है ओम्बुड्समैन के बात. एक बार यदि आप पब्लिकली इसको बोल दोगे, कोई भी इंश्योरेंस कंपनी आएगा आपको बोलेगा बताइए ना कैसे हम लोग इसका समझौता करेंगे. उसी समझौता हो जाएगा. माई कंटेंशन इज ओनली इफ यू डोंट रेज दिस इशू इन पब्लिक डोमेन, द इंश्योरेंस कंपनी इज नॉट स्केर्ड. दे हैव योर मनी and they use that money to fight against you. आपसे पैसे ले रहे हैं एडवांस में इंश्योरेंस के लिए, और यदि आपका कोई तकलीफ हो रहा है वो बेस्ट ऑफ लॉयर एंगेज करके उसको 15 लाख पर पेशी में दे रहा है, लेकिन आपका 5 लाख नहीं दे रहा है. What a dichotomy in our country. Okay, so what we all have to do is to ensure that we raise that voice at the right place in the right manner, which we sometimes fail because of our lack of resource. You know, we'll have to work towards that, and there are good Samaritans in the community जो मदद करता है. There are, in my career, I have seen in 40 years, there are good people in this world, especially India, who also help, which Lokesh does not agree with me, but there are good Indians also. You know.
Sir, here a friend in need is friend indeed. Okay. Always feel.
Cigarette. These are very common in our country. तो इसके लिए आपसे रिक्वेस्ट करता हूँ, कुछ इंश्योरेंस कंपनी में ऐसा किया जाए, क्लेम नहीं देंगे. डॉक्टर को हमको या पेशेंट को जाके मनाना पड़ता है, लिखो कि ये गुटके से नहीं हुआ, तभी जाके क्लेम मिलता है. Then one more request to Dr. Vyasamurthy is, Senior Citizens Forum, from your association, you can write to Finance Ministry for removing GST on health insurance for people above 60. I think that will be very strong.
Thank you very much, sir.
अरे उसको तो इंश्योरेंस ही नहीं मिल रहा, जीएसटी कहाँ से हटाएगा?
जिनको नहीं मिल रहा है वो सही है, लेकिन जिनको ले रहा है मिल रहा है, जो रिन्यूअल है,
अच्छा,
वो तो सेपरेट होगा.
Okay, please go ahead.
Good evening, everyone. My name is Satish, and I am an insurance service provider. My question again is to Nirmala ma'am. The question is, we have just
बहुत तकलीफ के बाद उनको लाए हैं, आप इनको इतना
It's a rare opportunity for us, sir.
आप उनको रात में 12 बजे तक बोल दिया.
It's the best opportunity for us to.
She is representing the ombudsman who is holidaying, and you are putting her into trouble.
Next time आपका invitation नहीं आएगा.
Or any of the panelists can answer. In fact, it's an open question. So we have just understood that if a case is actually taken up by any other forum, like consumer forum or any other forums, then the consumer will not have the option to approach the insurance ombudsman. Then, how about someone approaching insurance ombudsman, and if the case doesn't go in favor of the customer, will he or she have the option to approach the other forums or district courts or the high
complainant? He can approach other forums after that.
Just 1 minute.
Insurance company can.
If the award goes against the complainant, he can approach consumer forum or court or any other forum.
Okay. Thank you. Madam, how many questions you like to take more? Because I think, see, it is not fair from our part inviting her and doing it.
Madam, one small question.
Yeah, last 2 questions here.
Last small question.
That is respect. Yeah, he and you. Okay.
Just one second.
After him, you talk after him. Yeah.
Sir, one small question. Actually, it's a good initiative taken by the Ombudsman, because I think it is an internal arrangement made by the companies to make a Ombudsman to resolve the issues, resolve any disputes. Okay. Because you need not to approach any lawyer like that thing, because it is a simple mechanism.
That's right.
Now my question is actually, now what I heard is most of the case go unnoticed, rather not paid, and customers also sometimes they neglect. What I heard is the statistics shows us more than 25,000 cases go unnoticed. Hardly 2,000 to 3,000 will come up to ombudsman. Now my question is very clear. Do you take any initiative to educate the customers in this regard, that you can approach ombudsman with simple process?
Yes, we have.
Please, last.
Payment itself is a motivation.
Sir?
Paying tax, paying.
Awareness. Madam has already replied. Again, she is replying. Amir also covered it.
Actually, we have initiated many publicity activities like giving banners to insurance companies' offices to be displayed in prominent places. We have had a display of ombudsman with address and email and phone number in the metro trains in Hyderabad. All the public sector insurance companies we have covered this year, and next year, I mean, we will be covering other private
and
insurance.
also the Bima Lokpal Divas.
And yeah, Bima Lokpal Divas also we had conducted in an elaborate manner. We had distributed pamphlets there. Actually, here also we had distributed some. I mean, we had given some. It is distributed.
Yeah.
Some pamphlets were given here also. And there are other activities taken by the CIO, Council for Insurance Ombudsman, have also taken up campaigns like some jingles in FM radio, All India Radio. So many initiatives have been taken by the Council for Insurance Ombudsman also, and
more are in the pipeline.
More are coming.
Okay, sir, here, yeah, last.
Yeah, good evening, everybody. My name is Ramanan Singaram. I'm an young insurance broking agent. And my suggestion to the Federation is basically like I'm also from travel industry. From July 1st onwards, we have a new thing called tax collection at source. Instead of GST, the body can give it as TCS. So I pay my tax. Anyway, I pay my tax. Again, at the end of the year, when I'm filing the my returns, my whatever the tax you collect, you can repay some part of it, so that I am also happy. And for the senior citizen also, that he is also ready to pay tax to the development of the country. Instead of 18% GST, they can put 5% TCS. He is also having an happiness of giving the money to the government, and he also gets something out of it, like a rebate.
Good suggestion, we'll take it forward.
And one more thing is Akshaya Tritiya is coming. Instead of Akshaya Tritiya, like the trade union can say insurance to be.
Okay, now thank you. Is to Rajivji, okay.
Sir, you pointed out that the companies, the founders or directors getting feared because of the. So, what is happening in the overseas market? Do the laws same? How are they manufacturing and how sustainable they are? Is there any difference?
99% cases, Europe, Canada, USA, if there is a non-compliance of quality, like in a car, clutch plate fails, airbag fails, car company will voluntarily call the car back and get the things changed at free of cost basis. That's how it's done. Nobody goes to the jail for that. We export to Europe, we export to USA. If things go wrong, they allow us the chance for improving and satisfying the customer. We don't get a threat immediately that we're going to be having a raid coming in the factory and the inspector is going to be coming and then threatening us that I'm going to be behind the jail. And when we go to the DCGI and complain to him, the DCGI himself says, the inspector thinks he is more khuda than me. I've got cases for silly stuff where I'm supposed to go to Kerala for court hearings. And these cases go on for. That's where we have gone totally wrong in India. And we need to correct. But when we start talking about this, then the government will tell us, it's the patient forums who are demanding this. They feel that we want to get away scot-free. It's not that we are responsible.
And you believe them. And you believe them.
Yes.
Why
So
do you believe them?
It has to be a balanced thing. In USA and Europe, you will be basically asked to either recall the patch or correct it. Very rarely they'll tell you we'll close down the factory or we'll suspend the. You can't do business like that. It's an engineering product. It is not like a chemical. कि आपने एक चीज टेस्ट करी है, the whole batch chemically will be the same. In an engineering product, you will aim for zero defect. You cannot have zero defect. It's a reality. The best manufacturers cannot achieve that. Motorola put in the system for 6 Sigma quality. My company put in system of 6 Sigma quality. We supplied more than 4 billion syringes, for example, last year. Okay. And out of 4 billion syringes, we may have got about 150 complaints within the country. Most people don't make complaints. They don't bother to make complaints. We also think there must be at least 1,000 times that. And we have to be becoming better in that. We have a 6 Sigma system in the company and the plants run at 5.6, 5.7, 5.9. But to be at 6 every day is not possible, even with the best intentions.
Thank you very much. So friends, we have had a really very interactive, very good session. Thank you very much for your wonderful participation and making it very interactive. One big round of applause for us. Madam, it's really enlightening from the ombudsman part of it. Yes. And we should also thank Bijoy Mishra ji to get.
No, thanks a lot. You see,
very
you could see that, how much of information today you passed on to the citizens, and all these friends of mine will pass it on to so many other people. So my only motive of such interaction is exchanging information. I have learned so much from you all. You know, Lokesh may be keeping quiet, but you people said so many things which he never tells me.
Medical devices, lot of learning and will work together.
Yes.
I know you have got challenges, but at the same time you have to have import substitute also. So nation is first. Let us work on that thing. Chaturvedi sir, you have always been for the
in the 1-point program, we must get him exclusive legislation.
Sir spoke very well, and senior citizens will work together.
Thank you so much.
Now for giving the memento from all of us, can you come? Our friend Sannyasi Rao ji and Mr. Sukumar sir, can we invite you to present?
Please come on stage, sir, to present the mementos.
Please. So, see, for both of them getting up is a...
Yes.
Please come.
A great honor for us. A great honor for us.
Yeah.
Can we please have a huge round of applause? I think applause should continue.
You can start from here. Start from
here.
इनको दीजिए.
Sir, on photo, sir. Sir, on photo.
Beautiful.
More than that, have patience.
लाओ. इधर दीजिए.
Sir, please come now. Please come, sir.
Sannyasi Rao ji is very strong motivator.
Yes, I know.
Chaturvedi sir.
नहीं हम
वो तो देने वाले में पुराना फ्रेंड friends, tomorrow we have got the round table on the validity. So all the speakers, we request them to be here by 10:30 morning and we'll close by 1:30. Like to have your suggestions for quality and affordable health insurance for all citizens. We are those. Later on. Thank you. So, is that okay? Sanjay, anything else to be announced for tomorrow?
One photograph. Mishra ji.
Professor.
That's it. Mishra ji.
And tomorrow we are meeting on the ground floor.
Yes.
At Surana.
Surana Auditorium. 10:30.
Come.
Photo thing.
Yeah, one group photo.
Come. Yes, sir.
Come.
Sir, I trained more than 4 lakh people.
Oh.
In India and other countries on soft skills.
Oh, very nice. I'll give you my card.
Yes,
Come closer.
No, you are very...
Come closer. Yeah.
You are very open, sir. This country needs people like you. I would come and pull this आता
हम भी I normally let me give you my card.
Lokesh. Yeah, how are you?
Very nice. Tell them need a wonderful I hope you enjoy. You took it as